Check, check. Good. Use this one? Okay. Good morning, everyone. I hope you all had a good night's rest. Got to bed by 9 o'clock or so last night so that you're ready to fire up and be ready to go this morning. The fact that I got some of these memos at midnight, I'm going to take it out on you later if I have to. No, we got them in, and I really appreciate that you were able to turn those in so I could make copies of your memos for the judges. Just a little background, this is being live streamed, so for the individuals that are watching it, I want to provide a little background. The Henry Clay Center program started 18 years ago, and it's been progressed forward from year to year with slightly different versions, but the general structure in terms of who's actually participating is we select one student from each of the 50 states that's going to be a senior next year. So they've completed their junior year, generally speaking, and will be seniors. As far as the Clay Center program itself, the students arrived last Monday, and they were assigned to one of 4 topical areas, which you'll hear about this morning. And then the students in each topical area were further subdivided into 2 groups, Group A and B, and each of those subgroups were asked to develop a policy recommendation to solve the problem as they saw it. Then yesterday, those 2 groups came back together and under the theme of Henry Clay, sought a policy solution through compromise, civil discourse, discussions, and whatever it took to achieve a compromise. They finished those last night, and they prepared for their presentation this morning, and we're going to have 4 presentations. The topics are basically, the first one will be disaster assistance, which involves federal-state relationships. The second one will be healthcare policy. The third one will be homeland security. And the fourth one will be treaty and alliances internationally. All of these topics are of the general theme of intergovernmental relations, or fiscal federalism if you look at the financial side of those relationships. So we've asked them to define the problem they think is more serious in the full administration and achievement of the goals of these programs, which have been developed over the years by federal legislation. So that's our overall program. We have 4 judges that are going to be doing an assessment of their presentations, and they'll also be asking questions of the teams. We'll be identifying the team that they feel have made the best presentation, and they will be awarded recognition next week when all of the students go to Washington, D.C. for participation in various other activities, which includes a meeting at the Supreme Court, the German Embassy, the Bipartisan Policy Center, and other groups in Washington, D.C. And then we'll have the presentation on the last night of the program. So we really are excited about this morning's presentations. We have excellent students, and I know they worked hard, and I've seen their policy memos, and they've really thought through these issues, so we look forward to that. Now I'd like to introduce Bill Giles, who will introduce our panel.
Can you all hear me if I just lay this down? Is that okay? Okay. I am looking out at a sea of sincere blue and black suits. Our students at least look like they're going to convince us. But there are 4 people here who they have to convince. And I'll introduce each one of them. And if you would, turn around and wave to the camera, so to speak, so that you can be identified. First is Rufus Friday, who is the director for the Center for Integrity in News Reporting. They have a mission very close to our heart, to reduce bias in news reporting. He comes to that job after an extensive experience in publishing, particularly as the publisher of the Lexington Herald-Leader, our newspaper here in town. Next week when you're in D.C., you'll hear from some news people. And you should remember what we talk about his mission. See how they present themselves to you. So you have a good prep here, another set of eyes to look through. He has a degree from North Carolina State and an honorary doctorate from the University of Cumberland. Brad Calgill, wave back, Brad, there we go, is an attorney who has a company called SmartClaim. He has a bachelor's degree from Vanderbilt. We have a Vanderbilt person here, I believe. And is a law degree from the University of Kentucky. He's been involved with several of the leading law firms here in the state. But most importantly to you, and what kind of eyes he might be looking at this through, is he was the state budget director in the administration of Governor Fletcher. So his eyes may have that slant towards them. He's been a big community leader here in many things. I'm not going to go through them all, but he's also on the Martin School's Board of Visitors, which is a key piece in how the Martin School operates. And he's very involved with the Clay Center, obviously, that way. Our next guest is Terry Samuels. Terry. He is the president of the a nonprofit Kentucky Science and Technology Council. He mainly, I bet, came to Lexington as the vice president for worldwide management of the printer services for Lexmark. I think you're all familiar somewhat with Lexmark. He has a degree in electrical engineering, and then he has a master's from Xavier University. Last, not least, is Richard Dorhair. Richard is also an attorney in Lexington. He is my man of La Mancha. He takes on causes. Every once in a while, I'll just be sitting reading the newspaper, and bang, there's an op-ed. This is not unlike the role we hope some of you assume or feel gravitation towards. It is the man in the arena, and lady in the arena, excuse me, that doesn't just sit there. And he's welcomed everywhere in town, and yet he's a very strong, opinionated man for causes. He has a degree in both business and in law from UK. So you got a pretty disparate group here. And you all have various facets to your presentations. So when you get the questions, be prepared. Each of these gentlemen, it just happens by chance this year we have no lady, but each of these gentlemen may take that slant that their eyes look at this through. And with that, I turn it back to Merle and we begin. We ask that each time you present yourselves for the first time to introduce yourselves, say what state you're from so the people streaming back home can know. Thank you.
So now I'll ask the disaster support group. Thank you, Bill. Now we'll begin our presentations, and our first team that's going to be present to the judges and to the audience out there will be our disaster assistance group, when they'll be talking about federal-state relationships in that area and develop their policy recommendation, which they feel will enhance the effectiveness of that particular initiative and policy program. So the moderator, we have a moderator?
Yes, we do.
Okay, good.
Ready to go? Are we in frame? Amazing. All right. Good morning, esteemed guests, judges, friends at home, and members of the Henry Clay College Student Congress. My name is Anna Palumbo.
And my name is Braden Perung, and our coalition this week worked on creating a new intergovernment disaster policy, and we're so excited to share what we have come up with. But first, we're going to do a little bit of introductions. We have Jordan Hall, go ahead and wave, from Texas. We have Olivia Smith, who's from Virginia. We have myself, Braden Perung, I'm from Missouri. We have Trevor Nauta from Wisconsin, Rory Stewart from Utah, and Lily Kreinler from Maryland.
Amazing. And then moving on to Group B, this was more of the state-focused group, so a lot of our research over this upcoming week was focused on states having autonomy within their disaster research. And within our group, we have Luke Schofield from Massachusetts, Giselle Martinez representing Illinois, Drake Ward representing Alaska, myself representing Washington, D.C., Grace Gestel representing Tennessee, and Ryan Angles representing Connecticut. And moving forward to our table of contents, which is just what we'll be going over in the few minutes that we have, we will be discussing our background, a lot of the research that we received previously through our policy memos, and then Group A and Group B's proposals themselves, as we stated previously. Group A's focus was more on the federal side of disaster relief, whereas Group B was focused more on state autonomy. And then we'll get into the good stuff, which was the compromise that we came up with in the end. So we wanted to give a little bit of a background of the policies and the agencies that we'll be talking about. The United States disaster response doesn't truly begin until 1979, when President Jimmy Carter signed the Executive Order 12127, which established the Federal Emergency Management Agency, or FEMA. Then in 1988, the Stafford Act is signed into place, which broadens FEMA's legal authority and just gives some more guidelines of what the government can and cannot do and when and how it can do it with state and local emergencies. Then 9/11 happens, and it's very clear that there are gaps in the emergency and crisis responses. So the government creates the Department of Homeland Security in 2002, DHS, which houses 22 agencies, including FEMA when it was relocated under DHS in 2003. Since the 1980s, there have been 384 climate and weather disasters, which have totaled over $2.1 trillion in damages.
Yeah, and then in 2005, we have Hurricane Katrina. Katrina became a defining moment of FEMA, and not necessarily in a good way. The federal response was slow, disorganized, and deadly. Katrina exposed a lot of concerns that critics had about FEMA, which was that moving FEMA into this larger bureaucracy would strip it of its independence and focus when it's needed in a true time of catastrophe like this one. And then in 2024, Hurricane Helene renewed these questions about FEMA and these questions about FEMA's ability to hold large capacity and have fast response times in climate disasters similar to Hurricane Helene, as climate disasters in the U.S. are growing steadily and rapid now. And then in 2025, former DHS Secretary Kristi Noem passed a secretarial order that all awards and grants larger than $100,000 had to be passed across her desk before getting approved. This created significant restrictions and barriers for a lot of components of DHS as well as FEMA, which caused them to not be able to pass a lot of significant bills that were over $100,000. And then also in 2025, Representative Jared Maskowitz introduced the FEMA Independence Act, which is essentially a bill that removes FEMA from the DHS again, similar to how it was before 9/11 as an independent agency and before it was moved under DHS post 9/11. His response for this, or his reasoning for this, was that he stated that the DHS has just become too big and too slow to successfully carry out any of its responsibilities.
So from this background research, each of our groups synthesized a problem statement that we felt perfectly encapsulated the errors and issues of FEMA. And even though we both might have disagreed on the precise means to correct those issues, we actually had a lot of agreement on the core causes of those issues. So we came up with this unified problem statement, that FEMA is trying to exercise its key imperatives of disaster measurement, mitigation, and management. However, inefficiencies within the Department of Homeland Security, especially with intergovernmental communications, have led to a lack of local expertise and the continued degradation of public trust that has continued since the 1980s.
Before we get into Group A's proposal, I wanted to take a moment to talk about why the groups are a little bit different and where they are coming from. So Group A is supposed to be looking at the emergency response as a federal lens. So our goal is trying to make sure that the disaster response is primarily funded by the federal government, while also making sure that it is used efficiently and cutting down on waste, abuse, and fraud. With that.
So yes, as mentioned, we were looking at the federal side. And so when we initially were looking at our resources and reviewing the policy memo, we kind of noticed that FEMA was underneath DHS, but was kind of an outlier in a way. And a lot of the backlog had to do with how many agencies were underneath the Department of Homeland Security. So we decided to remove FEMA from the Department of Homeland Security, and instead of bringing it back to what it used to be as an independent agency, which had a lot of flaws, as they didn't have access to unifying the Red Cross and military resources. They just really did not have a place in a federal government to fully utilize their resources. We decided to create a brand new department called the Department of Disaster, the DoD. And under this new department, we couldn't just have one agency, so we decided to combine FEMA and then NOAA, the National Oceanic Atmospherical Association, and the EPA, the Environmental Protection Agency, as each of these agencies focuses on a different aspect of disaster relief. NOAA is the initial broadcaster and forecaster in monitoring these natural disasters. Then FEMA is more of the short-term, immediate relief to various states and areas where natural disasters are being impacted. And then the EPA is more of a long-term infrastructure and focus on public health and various aspects of the future of natural disaster impact.
And we also wanted to look at Stafford Act provisions, just updating the federal cost share percentages. So specifically, we wanted to increase the federal cost share for public and individual assistance. So public assistance is things like debris removal, and individual is for like specific households. By increasing them from a minimum of 75% to a minimum of 90%, we're increasing the federal government's role in ensuring that as disasters get more severe over time, that the federal government is picking up most of that cost. The second thing that we wanted to do was increase the federal cost share for mitigation grants. So if it's after a major disaster, the state gets a set amount in addition to funding public assistance and individual assistance for mitigation to prevent it in the future. So this is dealing with the specific individual grant. So if a town has a project that's $1 million, they can finance 75% of that using the federal dollars that they get, and the other 25 is the state dollars. So we're just increasing that to 90%, giving the towns a little bit more wiggle room so that way they can finance more expensive projects that are going to last longer, ensuring that. And then in order to get those two benefits, we were going to ask that the states allocate 5% of their rainy day fund to disaster mitigation and prevention. The way that we decided on this was just if the state, or since not all disasters go to major disaster declaration status, the state will have some money to ensure that they're doing what they need to do.
Thank you, Trevor. So while Group A was working on the federal side of disaster relief, Group B was focusing more on state autonomy. And this was very interesting because while some of these programs exist, they aren't very strong. So we were able to do a lot of research through that, which you get to hear now.
Thank you. So Group B had 4 primary policy proposals. We believe that these slashed red tape, empowered local officials to respond to disasters with localized experience and knowledge, and we believe that these expanded the rights of states. So first, similar to Group A actually, we decided that FEMA would be removed from DHS. We believe this was because it is subject to very partisan congressional allocations as a part of DHS, and it contributes to simply broader red tape. We thought it would be an independent cabinet-level agency with an appointed and Senate-confirmed secretary. Second, we decided state auditors would have the ability for oversight over programs decided by FEMA. We believed that this would grant states the autonomy and the oversight to be able to decide what happens with investigations of waste, fraud, and abuse in these programs, and give a little bit more power to the states there.
And then our third proposal was dissolving regional offices. Since right now it's kind of chaotic when these regional offices are partnered up with different states. A great example of this would be Kentucky and Florida. Sometimes that gap between these states kind of give these regional offices a little bit of unpreparedness and not have knowledgeable about what kind of resources and aids need to be distributed between these states. Like Kentucky is known for tornadoes and Florida is known for hurricanes. So by having these regional offices kind of delegate what needs to go where, sometimes by partnering up these states with another state that doesn't really correlate to the natural disasters outcome that they have can cause unorganization. So by resolving these regional states and having our local states kind of have more structure and a little bit better of a structure flow when knowing what resources need to be sent out to these disaster outcomes is a little bit more better for the states to have power and overseas and not waste so many resources, but have more knowledgeable on what stuff is actually happening when these outcomes come from these disasters. And then our fourth and last proposal was investing in federal funded technology, specifically in drones, as it oversees and prepares these resources and these federal aids to know what they're going to come and what they're going to face before actually going and sending unnecessary resources to these states, as well as the cost. It's really lower compared to the operational cost right now. For the operational cost, when sending stuff out to these states right now, it's at $650 per hour, which is really expensive long term. So by investing in these federal funded technology with these drones, it reduces the rate to 95%, making it a little bit more cheaper, just because you want to plan throughout the whole year in case of any natural disasters.
So as you can see, both groups' policies were kind of similar in areas, but different in others. So these each were created Monday through Thursday, and then Friday we came together to create a compromise. As Luke was talking about, our problem statement was very similar. We really wanted to make sure that FEMA was really doing its job. And now, the compromise.
So yeah, the first thing we looked at was the name specifically. So the Department of Disasters presented by Group A. We had some conversations about, is the name correct? Does disasters kind of include everything that we discussed? And also kind of the Department of Disaster also kind of indicated a little bit of the department was already under a disaster. So we didn't want to do that. So we decided to reformulate and rename the district, or the department, excuse me, to the Department of Response, Operational, and Preparedness, also known as DROP. And we also had different conversations about the agencies that we included. Group A initially presented FEMA, EDA, and the NOAA. So we kind of wanted to talk about that. We talked a lot about including the EPA, also specifically looking at the Office of Land and Management Emergencies to see if we could remove that, but looking and doing more research, there was a lot of congressional oversight, disapproval, and also looking at executive orders that wouldn't make that process perfect.
Okay, and then our second compromise that we came to was dissolving regional offices and having state liaisons in every single state. So this was originally proposed by Group B. They were wanting to dissolve all the regional offices and then have all those employees go to Washington, D.C. in their headquarters. But Group A had a lot of pushback on this because a lot of it was like, how are these employees going to get to these further states fast enough for like disaster response, like going to California or Alaska? And then also there was also a concern about streamlined communication, because between the federal and the state government, like FEMA and state governments, they were worried about not communicating very well and not having these people really easy to access and having them all in Washington, D.C. So we came up with a compromise to have state liaisons in every single state so that there was direct communication between FEMA and these state governments. And then these liaisons would be housed in different, like each state's disaster response departments, offices, and that would help improve communication between FEMA and these state governments, and overall help with disaster response times and be able to give the resources from FEMA to these state governments. And then our third compromise was having state auditors look over funding and spending of FEMA resources. We actually didn't have a lot of disagreement on this. We thought it was a good thing to give the states more autonomy in auditing these types of spending and funding. A lot of what we talked about was also adding that like a cohesive, like standardized, like how to do the audits across all the states. And then also we talked about also like having
like just more oversight to the states and giving them more power. And then also if the state, having the federal government have the last like final say and authority to oversight what the state governments do if they drop the ball and misuse funds or things like that.
And then regarding the funding percentages, so the cost shares, there was a lot of concern about the individual assistance and the public assistance, just with raising it from a minimum of 75% to a minimum of 90%. The federal government would be much further on the hook for that. So just the budgetary concern and then possibility of that. And the second thing was the hazard grant mitigation plan, so the percentage that they would get for their individual project. That one, the concern here was more that states could, or towns, when they're financing these projects, could go after more aggressive, unneeded additions, so that would create a little bit more waste. So we cut back on that up to 90% and dropped it back to 75%. Then finally, for the rainy day fund allocation requirement, that the states had a little bit of a concern with just the feasibility, since not all states have a rainy day or an equivalent fund. And then in addition to that, 5% is quite a substantial amount to allocate for disaster relief. And just considering the states, every state's different. Some have more disasters, some have less disasters, so it was a little unfair. So our compromise here was that instead of touching those areas, we would touch the total amount of funding that the state would get for their projects. So right now there's two different types. So there's standard plans and enhanced plans. Standard plans is just 34 states have them. They're pretty just having a disaster plan, having something that works, and then they get 15% of the total cost back for future mitigation projects. And then the enhanced plan has to do a little bit more work, demonstrate that they can handle the excess funding, and that it goes a little bit more in depth overall. So that's at 20%. So we're just going to increase both those categories by 5% apiece. And then in that manner, the state should be able to finance more projects. So although they're not as in depth, we're cutting back on the waste, fraud, and abuse, and just making sure that the states have enough money.
Now we're going to get into what this new agency will actually look like. Obviously, there's three main arms sort of made up of the three former agencies, the EPA, FEMA, and NOAA. And then we made a quick organizational chart. We have our new Secretary of DROP, President appointed, Senate confirmed, standard. And then we have our sort of auxiliary positions. We have our Deputy Secretary and operations, our PR team, our government affairs, that sort of stuff. But then we get into the meat of the organization, which is the sort of, you can see the three former agencies represented here with our assistant secretaries. And I won't go into what each little box is, but these will just sort of help streamline. They can report to one secretary who's strictly focused on disaster relief and just improve the disaster mitigation process overall.
Yes, so we hope that you all enjoyed seeing a glimpse into what our week has looked like, and we thank you so much for listening. We, of course, want to give a major shout out to our mentor, David Stevens, who recently graduated, yes, who recently graduated with his master's at the University of Kentucky and has been imperative in our entire process. And we want to thank you all for listening. And does anyone have any questions?
This is where the hardball questions usually come. Go ahead, give it to him. No, okay.
Really did a good job. Beautiful. I would like to know, in terms of what are the regions doing now? And how many are there now?
So there's currently 10 regions. I don't remember the exact state allocations, but they're pretty standard, you can imagine. But what they are now is essentially an auxiliary of the federal office. They have their own directors that try to use some sort of regional expertise to facilitate faster response. But they end up being sort of redundant because any big decision they make has to go through the federal office or the main office in DC. So we were just looking to get rid of the middleman, cut out the wait times, and empower each state's office, which go by various names, but each state office to just collaborate with the federal office in DC.
The regions, the folks that actually show up at the scene, are they within that region? Are they located? Are they coming from various states? We know they're coming from various states, but what does a region do? How many people are in the regional office?
Total, I believe, across all regional offices is about 4,500. Does that sound about right? Yeah.
Okay.
So, and if we were to dissolve these regional offices, we're not just going to send all these people home. They're going to be sent either to the state offices to sort of collaborate with the state agencies, or back to the federal offices. So, how the regional offices work now is when there's a disaster, let's say in Florida, the regional office is in Georgia. So they'll send some people down. It's a lot quicker to get to Florida from Georgia than it is from DC. So there will be that first wave, smaller regional wave, and then the big national team will come in. So we just wanted to move that directly to the state instead to just speed it up overall. And then we're still waiting for the big federal team to come in. So.
So as it currently stands within these regional offices, they do still collaborate with states because, for example, the region that houses both Kentucky and Florida is in Atlanta, and they collaborate with states. So say there's a tornado in Western Kentucky, which did happen last year, you would have them collaborating with police forces and fire offices and like the Red Cross, who currently are based in those areas, and then send some of their resources as well. So while these regional offices would have a bit of shift between where they end up going afterwards, they do currently collaborate with these state offices that they would be able to strengthen and join to.
Okay. Just one final question. The funding, the mitigation funding and the first slide you had was 75% to 90%. That represented something, and it's different from the mitigation. I want to know, please, what that represented and what is it currently, and the same for the mitigation funding. What is it currently?
So from the current levels, so there's public assistance and individual assistance. So that's at a minimum of 75% the federal government has to handle, so they get some wiggle room there. Regarding the specific grant, that is at 75%. So the state, so a local project could finance up to 75% of the project using federal dollars. The way that the mitigation plan changed a little bit, I'll just walk through. So if a disaster occurs, the major disaster declaration gets signed, the FEMA comes in, and then they calculate the individual assistance and the public assistance. Then that funding is at a minimum of 75%. Then after they get the total number, depending on the state's plan, if it's an enhanced plan or a standard plan, they take whatever percentage of that total number in addition to then they give it back for the future grant projects. So that was the number that we were changing, and then the individual grant.
Overall, did this group lower the federal percentage for help for people that need it?
No.
Okay.
Because it's still, the federal government can still go above 75%. We were just going to try to create it like a standard for it, but we were just concerned about on the hook. So we're giving the federal government a little more space depending on the community or the area that does have the disaster occur. But then that total grant mitigation funding, it's going to increase for everybody. So
okay, that was not
that makes sense.
Really clear, but thank you so much and good job.
Yeah, I thought you did a good job too. By the way, I know that I violated the dress code. I didn't get the memo. I'm trying to get my head around this, and it strikes me as basically a structural problem. That is, ultimately it's solved by changing the relationship of the rectangles on an organizational chart, and within each of those rectangles is sort of a description of resources and responsibilities for that particular block. I guess in my mind there are sort of two aspects that guide the arrangement of those rectangles. One would be the efficiency and effectiveness with which whatever resources have been deployed actually impact the objective. That is, if there are some priorities, how quickly and how effectively did we actually fulfill those priorities? But the other thing that you get with this organization of rectangles is who gets to determine what the priorities are. Do the priorities get people fed this week, or are the priorities to replace that bridge over there? Those are very significant questions in the deployment of resources, because the bridge is probably going to last another 50 years, whereas this person could starve if they don't get help. So I want to address this question to somebody on the B team and ask whether, well, not whether, but to what extent the question of whether identifying and determining what the priorities are should be shifted to a more local focus as opposed to a national focus? How much of that is what's driving your decision? Who's on the B team?
Obviously, coming from the state perspective and coming from a state like Alaska, we have a lot of feuds with the federal government because, we say they don't know what we're doing up here. And so coming from that perspective, I wanted to say we wanted to empower the states to, feds, just give us the money, we'll do with it what we think is best. But obviously, Group A didn't want to do that, so we had to compromise. And so I think we ultimately came to the decision that the states, because of their localized expertise, should be able to employ that expertise with the oversight and the independence of that new branch. But to get back to your original question about how we're going to allocate that, I think it's best done by the states because they live there, they know what's going on to the level that no federal officer can. So, of course, the federal branch is there to make sure nothing crazy is going on, but ultimately the states know what's best for their state, and so they're empowered to allocate resources however they think is best, whether it's for a bridge or for food or for debris removal or what be it.
And then to add into that as well, answering your question of what our main goal is or just overall, yes, a cost is a really big factor, but one of the biggest things that was really important to all of us was to make sure that these communities and these people who are suffering because of these natural disasters are well taken care of, have the proper resources, have the shelter, have the food, clean water. So I think the biggest thing for all of us was making sure that these people are well taken care of and know that there's support behind them.
Question for Group B. How did you get beyond just feeling as though Group A was just pushing another layer of government on you?
Obviously, we had some qualms with the feds coming in and telling us what to do. So we ultimately, Group A's original proposal, if we can go back, was for that 5% state rainy day fund allocation that we definitely had some qualms with because the federal government can't mandate it, but they can strongly recommend and sanction us in other ways. So states like Alaska, where I'm from, have lots of budget issues, and being told 5% of all your rainy day funds have to be put aside for this, that doesn't sit well with me or with the members of my group. So we were able to sort of strike that part, give concessions in other places. So yes, in some areas, the federal government is exerting more control through, there's a whole new department, right, just to oversee disaster response. In other areas, we were able to get more money through these hazard mitigation grant programs, and I think reach a good compromise of oversight but not control, where we're able to use our discretion and our expertise to best affect our communities without the federal government being too worried about what's going on.
If I could add to that, I think it really helped when we got together and we discussed our problem statements, which we had crafted, after hours of deliberation within our groups. And we learned from Dr. Corey Curl earlier this week that your problem statements should not have the intended solution embedded in them. So when we got together, we said, let's remove all biases of both the groups. Let's get down to a core issue. And we found, of course, that we pretty much agreed on the issue, that there's too much disorganization and politicization and polarization within the Department of Homeland Security. And by finding that baseline, that agreement in and of itself, we were able to really build constructively upon that.
So my question is sort of to both groups from the perspective of, it was during all the budget hoo-ha earlier this year or last year or whatever. I never knew the Coast Guard was part of DHS, right? We all know ICE and Border Patrol, and that's what gets in the press, and I knew FEMA was in there, and it's like, where'd the Coast Guard come from, right? and I don't think any of you were born in 2001, when September 11th happened, but there was just this reaction, right? And so they threw all this stuff into a big pot, and they stirred it up. And sometimes a ratatouille is good, and sometimes it's like, who put the squash in there, right? And so from that perspective, I'm struggling a little bit on EPA. And EPA feels like it's much more of a regulatory agency, and I don't know the full scope of the EPA, but they're the ones that ban pesticides or whatever it might be. And it feels like you're doing that again by putting EPA in with something that's job is to react versus EPA is to regulate. And that may be a little bit more of a Group B question, but I'm not sure which would be. But it just doesn't feel natural for EPA. NOAA a little bit, yeah, I see that because these are all weather related, but EPA is a struggle for me.
And so, yes, we also talked about that. We really, coming from Group A, we initially put the EPA in thinking that, because when we went on their website, we found a lot of overlap. They have a section on their website of how to prepare for disaster, which we thought would be more under FEMA and NOAA. They had a section on relief efforts and things like that. And yes, there are other areas in the EPA, which is why we initially discussed separating the EPA into different offices, that the office is still focused on public health and other areas on oil spills that not necessarily are natural disasters would be under the EPA still, and then we would just take some of those offices out, and we just really struggled with the statutory limitations of doing that. And so when we were discussing it, we also found that FEMA originally started as an independent agency, similar to how the EPA runs now. And the FEMA ran into many issues with pulling resources and really just having a unified effort in responding to these natural disasters, which is why it was originally thrown under DHS, because they thought that they could kind of encompass all disaster relief, which really was not how FEMA was originally intended to operate. And so that is why we decided to bring in the EPA to hopefully address those struggles that they have as an independent agency. And that, similar to how also like DHS or other government agencies, there are kind of just a bunch of agencies thrown under departments that kind of operate, like the Commerce Department. NOAA's under the Commerce Department right now, but along with other organizations that you really don't see the relation to. And so we kind of felt that EPA's main thing was infrastructure and focusing on efforts to like decrease the impact of disasters, not just natural. And so we thought this could be a good way to bridge that gap and also make sure that these organizations aren't working towards the same thing, that they're working together, but each have their own area of expertise.
I think we can thank this group for their presentation. Will be healthcare. Please come forward.
Great job, y'all.
Hello, dearie.
Hello, hello. Best
Oh.
of luck.
Thank you. Is this on? Hello?
Yeah.
It's on.
You're on stage.
I know, I'm excited. It's a good day to have a good day, isn't it? My voice isn't totally gone, so
Okay,
that's
that's
good.
good.
Yep. Talking about what I love. It's going to be a good day.
Oh, I don't need this.
No.
And then, like, just do the next.
Awesome. Thank you. Can we move that? Because we're a little bit closer. And then we can accept
Oh, are you talking in between or no?
Just a brief pause and let the judges complete their deliberations. Again, we're trying to hold this to like 25 minutes, right?
Yes.
We'll do our best. No promises.
We promise. No, we promise.
Okay, moderator.
Okay, awesome. Good morning. Welcome to our fellow delegates of the College Student Congress, our judge panel, and everyone watching at home. My name is Vivian Gates, representing Alabama, and I will be guiding you through the presentation of the Public Healthcare Policy Task Force. For our structure today, we will have 8 topics: prison healthcare, Medicaid and Medicare, health education, veterans health, telehealth, rural access to healthcare, tribal health, and national security. In the broad scope of all that is public health care, we have a lot of passions here, and we're very excited to present each of them with our problem statement, moving into the compromises, and then ending with a question and answer section. But before we get into that, we'd like to let you all know a little bit more about who is presenting to you today. So we have Claire Mosqueda from Hawaii, Katie Ritchie representing Arizona, Matthew Tobin representing New York, Nyasha Rutanira representing Vermont, Jager Parks representing South Dakota, and me. And then from Group B, we have Lydia Lim representing Arkansas, Ferry Brezzo representing Pennsylvania, Emma Hone representing North Dakota, Blake Lindeman representing Montana, Gavin Walker-Mason representing New Jersey, Nicole Rice representing Idaho, and Skylar Rayner representing Kentucky. Group A was tasked with the federal side of our public health care compromise, and Group B was tasked with the state side. And I'm going to move it over to Gavin for some elaboration.
Yeah, thank you so much. So the United States, of course, faces many different public health disparities, and those change across states, across populations, et cetera. And so we were looking at what is the best solution to solving those issues. And so Group A, as Vivian mentioned, was charged with arguing on the behalf of the federal government, so having public health be under the jurisdiction of the federal government. And Group B was charged with the state government, so having the jurisdiction of public health being under the states. And so for the federal government, of course, the pros being it supports national interests and a more uniform approach to solving a large variety of different public health issues. And then the state government pros, of course, were more autonomy and more cultural sensitivity in addressing individual needs. And so the rest of our presentation will unpack what our compromise was and how we met in the middle.
Our first topic is prison healthcare.
Back to me. Thank you. So prison healthcare currently is under the state's control. So public health issues, all of those details within do prisoners get health care, how much health care, what access do they get, is under the states. And so as you'll see in our chart, California spends about $130,000 per year per prisoner, which is substantially bigger, more than 4 times the amount that Alabama, for example, spends on their health care for a prisoner, which is about $30,000. So what this means is there's a vast, differences across the United States with how much health care, what access prisoners get. And so the landmark case, Estelle versus Gamble, basically established that prisoners have a right to basic health care, but nonetheless, there's still many different cracks that prisoners can fall through, which we'll address in our next slide. So some of these examples are understaffing, delayed care, inadequate mental health care, extreme heat exposure, aging prison infrastructure, just as a few examples. And so these are issues that we need to address, and we're hoping that a more collaborative approach between the federal government and the state government could help address those things. And so one of the things that our groups came together to establish is building a stronger database system. So one of the main issues that one of the reasons that all of those issues kind of happen is because there is no standardized database system. So there's no way to track what are the trends from Alabama, who's spending less money, to California, who's spending more money, regarding the infrastructure. So basically, we want the states to give the data about what is happening in their prisons to the federal government to create standardization, so that way we can still have the control under the state government, so there's still some collaboration there, but it's still ensuring that there are some kind of standardization, there is some sort of compromise between states, so that way all states have decent health care for their prisoners.
Our next topic is Medicaid and Medicare.
Medicaid and Medicare are one of the most highly contested fields within public policy right now. So I want to dive quickly into what the two groups came forth before the compromise. First and foremost, for Group A, we see the nationalization of Medicaid coverage. Specifically, right now, we see that Medicaid is an opt-in basis, in which 10 states haven't done so. If we were to see the nationalization of Medicaid coverage, we would see a reduction in the number of uninsured low-income Americans. This furthers the second point of Group A, establishing stronger and more equal national health care standards. If we were to see the nationalization of this Medicaid coverage, we would thereby see more consistent health care access regardless of geography. Which brings me to point B. Group B had 3 main priorities on their to-do list, most specifically Medicare accessibility in the long-term disability qualification, which currently takes a minimum of 25 months for processing and approval. In order for a temporary SELV, we've brought forth 2 different proposals. First of all, the state early access petition, and second, an SSDI urgent disability processing. Now, this is a Band-Aid to a bullet hole, which is why Group B has brought forth a long-term solution as well, pursuing the funding of Medicare personnel shortages through a disability determination services grant, which would thereby reduce processing delays and increase hiring and retention in the administrative services which are provided through Medicare. Finally, Group B wanted to see a revised Medicaid model. Under the status quo, we currently see a pre-approval model in place in which we'd like to see the revision of a file and implement model. Which brings us to our compromise. What you're going to see here today, judges, is that both sides got substantially what they wanted, with Group A receiving their Medicaid expansion adoption and with Group B receiving their Medicare and Medicaid provisions. Where the compromise falls is within Section 1115 of the Medicaid model. If you do not elect into the Medicaid model for expansion, you do not receive the benefits of the file and implement model.
Our next topic is health education.
Group A chose to highlight health education as we want to invest in our youth and invest in our future. Right now, only 22% of Americans are proficient in basic health literacy. This health literacy leads to misinformation, and misinformation leads to poor outcomes. Areas of health education can include disease prevention, vaccines, nutrition, substance use awareness, but we wanted to highlight a specific area as a case study for our failings in our public health education. We chose to highlight sexual health education as our case study. Compared to our Dutch counterparts, American teens are 2 times more likely for higher abortions, more likely for teen pregnancy, and have more rates for sexually transmitted infections. This is because we have inconsistency in education throughout our states. The CDC recommends around 18 topic areas in our schools around sex education. Less than half of our public schools meet these standards. Additionally, medically accurate sex information is only required in 13 of our 50 states, whereas the Netherlands starts that in every province starting in kindergarten. Our proposal from Group A was to expand the student support and academic enrichment grants in the Every Student Succeeds Act. In doing this, we would add medically accurate and comprehensive sexual health education under the activities to support safe and healthy students provision. However, we were met with some pushback from Group B, so we came to a compromise. The concerns were raised about state autonomy, personnel shortages, and parental interactivity. So we created a parental opt-out. If parents felt uncomfortable with this, they do not have to have their children included in this. Additionally, we added a state health department partnership, allowing for states to give some of the money to their health departments to encourage health outreaches for states who do not have teachers in those health teachers in their schools. And then we updated the language. Instead of doing comprehensive sex health education, we had medically accurate, age appropriate, to have a broader array for states to choose from, but also to still have a baseline.
Our next topic is veterans health.
Okay, hello. I did some looking. Sorry, my voice is not the best. Please bear with me. But I did some looking into veterans healthcare and the problems that we're seeing in the Veterans Affairs system right now. The first problem that I noticed is wait times. The VA sets a benchmark for 20 days for services. However, in reality, most veterans end up facing anywhere from 45 to 60 days just to get an appointment scheduled. Rural veterans, on top of that wait time, also deal with long travel time, anywhere from 3 to 5 hours just to get to a service facility. Staffing shortages, so pushing appointments back anywhere from 3 to 6 months, and limited or no telehealth access. Another problem that we're seeing is in the Department of Defense and the VA system. They're currently not compatible, which means information has to go from the DoD, get fully processed, run fully through the VA, and then the veteran is able to get their services, which is really hard when you're going from active duty back to civilian life. You're already facing a lot of challenges. The last thing you need is a lack of health care. The central bureaucracy system also delays that healthcare, making it harder to get prescriptions, your records, and just actually getting that access to that healthcare. Group B came forth with a proposal to kind of address these issues. We focused on decentralizing from Veterans Affairs a little bit and turning it back to the state departments. We saw that maybe block grants would be a really good way to still involve the federal government while prioritizing the state. That also allows for immediate mental health access, and then also with integration of the DoD systems and the VA systems, we would be able to do state-level onboarding and data integration. Also, it would be very helpful if we focus on rural workforce investment, because right now care deserts exist over most of the U.S., so it really investing in those rural areas where our veterans are living to make sure that they're able to get the care that they're provided. The main problem that Group A came back with was they didn't quite see how the state infrastructure would be able to have the capacity to provide those services. Our final agreement was temporary reforms until the VA organization federally is a little bit more modernized, because they're still really heavily reliant on paper as their main form of documentations and operations, which really slows down processing for our veterans. Also, if we're relying heavily on the states, we would have to strengthen their infrastructure a little bit and use their systems really to their full capacities. Also, just a redistribution of current federal funding in the VA to focus a little bit more on where we need relief versus where are we putting our money and it's not actually serving the communities that it's for. Then our final compromise that we came to is what I call SAVVY. It's state-administered veterans integration. So what that allocates for is the federal veteran health block grants will be sent directly to health departments at the state level. Right now, they go through the federal departments and then to the state VA and then to the health department. If we cut that middleman out, we're reducing a lot of the friction that's catching it right now. So the departments would be able to get their funding about twice as fast. Veterans also will receive immediate 180-day mental health access with their DD 214 form. What I want to happen with that is, again, with that integration of the systems, that means that that form can just go directly to the state level and later be released to the federal government, rather than it having to get processed through the federal and then down to the state. Another thing I focused on was, again, Department of Defense. I already touched on this a little bit, but really just using those health information systems that already exist. They're being used by the VA, but the DoD is not a part of that. So I think just integrating those systems so it's all cohesive across boards. That way, veterans, while they're still active duty, are able to get started in the healthcare system. So then when they're released and they come home, they're already ready to receive healthcare. I also wanted to redistribute federal funds to allocate for state-level loan forgiveness for doctors who commit to rural clinics. Right now in my home state, North Dakota does this. We just struggle to fund it because as a state, we don't necessarily make enough revenue to be able to fund something like this. But we've seen a lot of really great benefits from it. Our rural hospitals are improving. So I think just receiving a little bit of federal funding for that so that states that need it can use it would be a really helpful way. So all of this overall kind of compromises to the federal government is still involved. They're still partaking and they know what the states are doing. They're allocating the funds. So if they don't think a state needs it, they don't have to. But it's up to the states to decide what they think that they need for their veterans.
Next, we have rural accessibility.
Rural communities face many issues ranging from hospital closures to vaccine gaps, disproportionate to other communities, meaning that there's disparities between urban and rural communities. For example, the rural flu vaccine coverage rate is 37.8%, but the urban coverage rate is 57%. Group B brought this issue forward because we believed that because of differences from state to state, state governments would be best equipped to handle those rural-urban disparities. And many of the disparities between rural and urban communities are due to a lack of necessary funding. So Group B looked at making federal grants, the guidelines more broad and flexible to apply to a greater number of issues. And Group B also requested changes in guidelines, a reduction in the number of guidelines. When we presented this to Group A, there were some concerns with accountability and appropriate allocation of funding if guidelines are removed and the grants are made more broad. So to compromise, we agreed to strengthen states' implementation powers and the federal government's oversight powers. To do this, first we simplified requirements. You only need to, instead of meeting 3 requirements per grant, you can meet like 1. Additionally, the federal government currently determines states' need for funding, and we changed that structure a little bit so that states can request the amount they want to be fulfilled, which helps them determine their own need. Additionally, we broadened some grants to include local health departments instead of just hospitals for eligibility. And finally, in exchange for all of this, the states will implement an accountability auditing program that will include financials.
Our next topic is telehealth.
All right, hello everyone. So telehealth is incredibly important in that it allows rural communities, folks who might not be able to see a certain physician because they're not in their area or a specialist, to have access through Zoom calls, etc. Just to make sure everyone's on the same page. And so what Group B, what we suggested was a 5-part expansion plan for expanding access to telehealth in general. So that involved things such as increased expansion of broadband and have the states control how that's rolled out, having interstate compacts or cooperation with licensure for telehealth professionals, investment in those professionals and in professional development programs through matching grant funds, having Medicare add reimbursements back in for telehealth so that people who are on those programs can access it. And finally, as an equity measure, use grants for AI translation and other means by which people who might not be able to speak English will have more access to physicians by opening that up. The 2 major sticking points in the negotiations once we brought this to Group A was kind of the loose language with the expansion of broadband. We left it very much, the states will do what they will with it. They wanted us to add the word implementation, so they'd still be in charge of a lot of the regulatory aspect of it, what's on the high back end, but the states would still maintain control over how that broadband looks. The second sticking point was the interstate cooperation. They pointed out very aptly that the federal government is kind of the body meant to do state cooperation. And so when we took those suggestions, came back to the table, we found that it was very much in line with both of our goals, and we just adopted those changes and adopted the program.
Our next topic is tribal health.
I'm back. So for tribal health, Native American communities across the United States are some of the most vulnerable populations when it comes to healthcare access. There's about 7.9 million people in the United States who are part of Native American or Alaskan Native nations or tribes. And these people have a significantly higher than average mortality rate compared to all Americans. And this is rooted in several compounding factors. For example, the Indian Healthcare Service, which provides the healthcare service that tribe enrolled members are entitled to due to treaty negotiations, receives at the least amount of funding for all civilian healthcare programs in the United States, with the Bureau of Prisons receiving double what the Indian Healthcare Service receives. And aside from healthcare funding, Native American communities across the United States lack basic things such as food security. 64% of counties that have this majority are considered highly food insecure, with the Navajo Nation, one of our largest nations, only having 13 grocery stores on a 17 million acre nation. And so to us, it was quite obvious that one of the biggest issues was funding, because if the Indian Healthcare Service is underfunded, if grocery stores don't exist because there's no way to make them profitable, so there's no market competition, that these nations need to be able to access some level of federal funding. So what we proposed was taking the grant system that already exists and increasing the amount of money in it, and having the requirements greatly loosened. The proposal from Team A, or their critiques of it, was primarily that it was relatively slush fundy, I guess would be the word for it. It was a slush fund where we didn't have a lot of requirements, and there wasn't a significant degree of specialized oversight. It was just fraud, basic protection of those grants. And so the ultimate compromise we came to is the Bureau of Indian Affairs would cooperate with the 575 tribes in the United States to, over the next 2 years, kind of look at this program, see what we need to be doing for an estimated or expected increase of 25% in the amount of money given to Native American tribes through federal grant programming for a total of $8.15 billion, with some of that money, about 10%, being allocated to the states to then provide for communities who are living outside of their reservations or are not federally recognized but are still Native American, so that we can further develop their infrastructure, their health care, and all the things that contribute to greater health outcomes.
Our final topic is national security.
Thank you. Alrighty. Diseases do not care about borders, making it a severe national security threat. And as you can see on the graph on the left, over 67% of states do not meet the 95% vaccination threshold to prevent measles. And as you can see on the graph on the right, there is a strong correlation between risk and vaccination rates. Second, you can also see a deeper, more underlying problem with the graph on the right. The white space is data inconsistencies, and that's something that Group A proposed a solution to. On the Group A proposal number 1, we've said that we needed an expansion of vaccine educational block grants in the United States. Second, we wanted to require state and county level reporting to the National Notifiable Disease Surveillance System, and we wanted to have the same to the Behavior Risk Factor Surveillance System. And then we wanted to add a $750 million grant to current vaccination programs. And fourth, we wanted to mandate all CDC recommended vaccine schedules. But as you can see, we had a lot of pushback from Group B. So our first compromise was saying that the federal government is going to provide a one-time grant for transformational healthcare and data reporting. And second, we're going to only require the 7 vaccine series that are critical in the United States right now with medical exemptions. And other vaccines will be subjected to religious and medical exemptions. Thank you.
Thank you so much for listening to our presentation. We all obviously came from different states and experiences and backgrounds, so it was a lot of fun to come together, put all our passions together, and really make this incredible compromise and become friends along the way. We want to shout out James, our incredible mentor, who has like 1 billion degrees from 1 billion different colleges. He was a great guide. He knows so much about public health, and we had a great time with him. But thank you, and we're open for questions.
I guess I get to go first this time, right? Never start with Richard. First of all, incredibly complex. The slide that you showed, that the 4,000 for and 15 grand for Medicare, and I mean, part of that's Medicare is older people and or people that are disabled, and it's going to be a little bit higher. But that is the difference in that is astounding. But did you guys spend some time? So you had telehealth, and you had VA, and you had rural, and I'm looking at those 3 things and saying, is there opportunity there to say, okay, rural is also a problem for VA, and was it your suggestion around North Dakota giving loan forgiveness for rural doctors? And I think a lot of states or the federal government or whatever does that. What opportunities do you guys see if you were starting from ground zero, which I know is naive, right? But if you were starting from ground zero, you're going to start a new country and build a healthcare system that didn't have 8 blocks that you guys had, right? The 8 blocks you had. What would you do differently if you just could start from ground zero?
Thank you so much. Obviously, this is just like an opinion, but based on the experiences that I encountered and we encountered, I think during the creation of this project, definitely more cooperation through the different departments would be very great, since many synergies would be released if, for example, telehealth, the department that operate telehealth, the department that operate, for example, Veteran Affairs or just the Indian Health Service, they will be able to cooperate with each other, since many of these problems really overlap. And obviously, that will be the role of the Department of Health and Human Services. And I think cooperation in this sense, altogether with expanded funding, will be able to solve most of the problems.
want to talk a little bit about someone can give me some information on the Veterans Affairs, the creation of SAVI. One thing that I was always an advocate for many years is that if I'm a veteran and I've served my country, why wouldn't there be a healthcare system to where I can take my veteran's card and I can go to any hospital in the country to get care? So talk to me a little bit about why you guys came up with instead creating SAVI.
Yeah, absolutely. I think that's something I was really passionate about too. Most of the people in my family are veterans, and I've just watched how they've struggled. And it's frustrating to me as well. Like, you serve your country, and now my country can't serve me back. And it's really frustrating, I feel. The reason why I turned it back to the states, and that's where SAVI kind of comes from, is a lot of the states are already trying to intervene where they can, since the federal government is so bogged down time-wise, that already the state has to step in and do a lot of just separate funding, and then other organizations on the state level, like your American Legion, your VFW, your American Legion Auxiliary, they already have to step in too and try to fund this healthcare for veterans. So the idea of turning it back kind of to SAVI is that each state knows how to handle their veterans best, knows the distribution of their veterans, and knows where like their rural access is, knows like kind of where their hospitals are. And so the idea of turning it back to the states was we're still operating with the federal government to provide our funding, know what's going on with their veterans. We're still operating through the DOD and the VA. But really, it's the problems that the veterans face in North Dakota or Montana is a lot of like distance, but in Georgia, it's a lot of like funneling into major hospitals. So it's just different per state why they're not getting service. So through SAVI, the different points allows each state to decide which ones out of that work best for them and just kind of reallocate services. Does that clarify for you? Does that ask me?
Just a little bit, but being from North Dakota, I know that I served a little bit of time in Washington State, and one of the things that we had an issue with was if someone needed some extensive veterans care and they lived in eastern Washington, they'd have to go over to the Seattle area. Well, during the wintertime, getting over the mountain pass was just next to impossible, but there are exceptional other private and public hospitals that were there that a veteran couldn't go to.
Yeah, and I think part of that is also like why veterans end up out of the system. So many of them end out of the system because they can't get timely service. So that's part of like what comes with the states is they're able to process you a little bit faster. So the federal government claims that they can process you. Once you're in like the VA healthcare services system, it takes normally about 2 weeks to get services because that's about how long it takes for them to process and approve your request. But if we turn that back to the states, you don't have to go through 2 weeks. Now we're looking at more of like a 1 to 2 day turnover rate. So, I mean, it's maybe not I can walk in. Ideally, that's what would happen. However, you have to go through, someone has to approve, like, yes, you are a veteran. Yes, this is true. So we can get that down to a day, 2 days. And we've actually kind of seen that in just a couple different case studies I did in my capstone course this year, where you can, when you turn it back to states like that, it is, and you have your DD 214 form done already, you can get your services in a 1 to 2 days. So, hey, I'm on a trip this weekend. I got sick all of a sudden. I can't go to the doctor today, but I can go tomorrow. So the states are able to process it just a little bit faster that way. Is that good?
This is an area to which I bring absolutely no expertise, so I struggle to be able to ask an intelligent question and not embarrass myself. But I was surprised that the letters AI didn't come into this conversation, particularly on the subject of telehealth. For myself, I can say that some really nice medical advice about what I ought to be doing with my life is coming to me by ChatGPT. And it occurs to me that if you were to extend that experience nationwide to 300 million people, they may not be getting quite as great bedside manner experience as they would be with their own physician, but if they're out in an Indian reservation or they're out in the middle of rural Kentucky, it's really not a bad option, and you could get some extraordinary advice and help on a range of subjects. So I'm sort of surprised in the context of telehealth that didn't come up. Of course, a barrier is to get people to have actual access to the broadband service and to know how to use it. So that strikes me as an area to address there. I was interested in the conversation. So these sound like statements, but they're intended to be questions for you to respond to. it was intriguing to me that in the context of 2026 America that we would find data reporting to be a deficiency. I would think we'd be swimming in it. But if, so I need some convincing that there is actually a problem getting accurate data, either about medical conditions or about the way we're treating them or the way we're financing it. I guess somehow connected to my first 2 points is a third one, and that is, you know, I'm always questioning cause and effect, and it seems to me there's a presumption that if you had, for example, more sex education, you would have fewer abortions and fewer sexually transmitted diseases, at least by comparison with the Netherlands. I would wonder whether there's a cultural component that actually has something to do with that, and not, you know, where is the evidence that shows that more sex education actually changes the teenage pregnancy, for example? I would sort of need to be convinced on that. Same is true with vaccines. Where is the body of evidence that shows that an education program actually changes the outbreak of measles? You would have to decide for yourselves who addresses those questions, but those are my questions.
Yes. So regarding telehealth, we thought about AI and we included it in one of the solutions, which would mean that we would give basically grants to states so that they can purchase AI translating services so that underserved populations that don't speak English, they could be able to access healthcare as well. And also it could reduce, obviously, medical costs, because if, for example, there is a Spanish speaker in Maine and there is a doctor that doesn't, and there is no doctor that would speak Spanish there, and it's a relatively less serious case, then that person could access telehealth and contact the doctor in some state that will speak Spanish. As for the broader implementation of AI, we thought about it actually, but since ChatGPT, according to research, is currently not in the state where it could constantly give basically true and verifiable medical advice, and since it has many hallucinations when, for example, it creates sources or it just comes up with solutions that actually don't really comply with science, in the current stage we are just not really able to implement that as a solution. As for broadband access, as you could have seen, we have thought about it as well, and obviously as if we lay the foundations for it currently, that could just increase the usage of like telehealth services. Later on, as these AI big data kind of like applications could become more trustable and verifiable, then we could implement that. But I think that will become possible in the next 5 to 10 years.
Regarding data, you are right that we should have so much data that we're swimming in it, but in reality, because of this state-federal fracturization, we're drowning in it because there's not consistent reporting from the county and state level to the federal level. For example, during COVID, states and counties, some of them would not report the number of tests that they actually gave or the number of hospitalizations. They would just report the number of cases. If I tell you that there's 50 cases and I tested 1,000 people, it's very different than 50 cases and I tested 100. And so with that, it makes the data essentially not as useful as it could be. In a different case, for example, Texas switched their like measles exemption from their health department to you could just do it directly through your school. So now there's no even reporting to their health agency. And so there's the exact same problems with the prison system that we described. And so the hope is just to say that this data is essentially, for the most part, being collected, albeit in disparate forms, but to standardize this collection at the state and county level and then put it into a federal database so that we're able to trace diseases and outbreaks and then hopefully treat them and prevent them. And then regarding vaccination, the idea there was that we didn't want to just come in and say the federal government wants to impose a mandate, because we think that vaccination is not purely driven, or lack thereof is not purely driven by, at least I don't even want to say that's what it's driven by, but that we don't want to just force people to take it. We believe that first there's a supply issue, which is why we wanted to invest into the existing vaccine programs, and also that there's an educational component to it that people should be informed about vaccination so that they are more willing to take it. And so we're again investing in existing educational programs.
I'm going to kick it over to Nyasha to talk about health. I can answer the sex ed question real quick. There have been studies that have been done comparing the states that do non-medical based abstinent-only teaching versus those who do comprehensive education. And sorry, the states that have comprehensive sex education do have lower teen pregnancy and abortion rates. Thank you.
Regarding the sex education, now that was under the topic health education. Why was that the only focus? In other words, why not include all of health, diet, lifestyle, soul, mind, and body, not including religion? When I say spirit, soul, mind, and body, the whole health that can make us get along and inculcate the great values at a young age. And the spirit part, I would say, is positivity, encouragement. That's part of health. Diet. So why focus just on this, on the sexual education?
Yeah, thank you for that question. And we totally agree. When we first outlined our priorities or what we thought was included in public health education, we looked at a variety of issues, sex ed included, but also vaccines, tobacco use, substance use and abuse. And we really wanted sex ed to serve as a model to implement this area and those areas into classrooms. So when you look at the Every Student Succeeds Act, we focused on a specific portion of that allocates grant money to creating healthy communities and healthy students. We thought sex ed fit squarely within that, and that by increasing funding and partnering with our schools and state health departments to focus on improving sexual health education, that we could use that as a model for those other issue areas that you mentioned.
And then also expanding on that a little bit, one of the components in our rural health program was an expansion of the Rural Health Transformation Project that came about recently with the Big Beautiful Bill. Included in that is an expansion. Currently, those funds strictly go to rural hospitals. We recommended an expansion to include rural local health departments as well, so that they can have the funding that they need to provide a broader health education program.
Let's give this group a round of applause.
Yeah, it's great. Looks good. Just whenever he addresses the room, he's got. Whenever he addresses the room.
And that would have Okay. Who's the moderator? You're in charge. You got the microphone.
Got it.
Just to let you know, whenever you address the room, no one at home or watching the screen can hear you.
Are you gonna start?
No, just go ahead.
Okay.
Is everybody, are your team all here?
Yeah. Oh. Actually, we're waiting
You're on.
for one more person.
Oh.
There he is.
All right.
Okay, ready.
You're on. Okay, everybody, I think we're ready to start. We'll turn it over to our third team, Homeland Security.
Thank you. Good morning. We are the Homeland Security Policy Group, and we are so excited to present our compromise today. First, we want to thank the judges for being here and the Henry Clay Center for this opportunity. My name is Clisty. I'm representing the state of Kansas, and I will be the moderator for our presentation today. So because the theme was an intergovernmental approach, we were split into two teams. The first team was Team A, which focused on the unitary approach. It consists of Lauren from Nevada, Michael from South Carolina, myself from Kansas, Emma from New Hampshire, Damien from New Mexico, and Jonas from Florida. Team B focused on the confederal approach, and it consists of Megan from Oklahoma, Joshua from Mississippi, Matthew from Michigan, Hank from West Virginia, Savannah from North Carolina, and Helen from Maine. An overview of our presentation is we're going to start with a background on the Homeland Security topic. Then we're going to talk about problems that we found in today's current society with Homeland Security, our unitary proposal, the Confederalist proposal, and our compromise, which we decided to name the Unite Act. And because Homeland Security is such a broad topic, we decided to focus on three main areas. The first is law and order, the second is counterterrorism, and third is immigration.
Yeah, we're just going to start with a little bit of historical background on Homeland Security and how it came to be in the United States. Starting with the founders. The founders really intended for Homeland Security to be decentralized from the federal government, mainly because they feared the executive authority following the revolution. So before the Civil War, we saw a lot of states having their own militias and having a lot of state control on the matter of Homeland Security. Now, during the Civil War and really the Reconstruction era, we see a shift in that, where federal authorities further centralized executive authority over Homeland Security, mainly to protect civil liberties in the South in the Jim Crow era, to protect freed slaves from further prosecution from people down there. And then in the late 19th and 20th centuries, we really see another shift with a big immigration boom from places outside of what was normally seen at the time. So we see certain policies and the expansion of federalized authorities on immigration as well. In the war era with World War I, World War II, and the Cold War, Homeland Security became much more centralized with various policies like Japanese internment camps, the National Security Act of 1947, which created the CIA, and the Federal Civil Defense Act. Now, the big turnover for Homeland Security in the U.S. was really in the late 1900s and really 9/11, where the fear of terrorism and the reality of terrorism that we saw in this country centralized Homeland Security to the point that we haven't seen before, especially with the USA Patriot Act in 2001 and subsequent legislation which really increased surveillance on citizens of the United States and other people who were here, and really changed the scope of Homeland Security for years to come.
Now we're going to move on to more present problems. So in a modern post-9/11 world, the United States continues to increase federal powers and response when regarding Homeland Security policy and issues. This expansion of power is usually meant to increase cooperation and coordination in response to these threats, but there leads to a lot of concerns and violations of civil liberties. Policies such as the Patriot Act or the Foreign Intelligence Surveillance Act raise many concerns regarding the concentration of power, more federalist power, surveillance acts, and privacy rights with citizens. And now we have to navigate this world of to what extent does national security intrude on state and local jurisdiction and also civil liberties, which led us to the main point of how should the United States balance national security, civil liberties, and federalism in responding to a more modern homeland security threats.
So I was a part of Group B for the Confederal proposal, and based on this question, we formulated our issues into our three main topics. I'll start with law and order. So we decided to put ourselves in the mindset of the most extreme position for a Confederal proposal in order to have a more exciting deliberation when it comes to our bipartisanship. So we're starting with law and order. First, we were proposing that we would basically allow the states to investigate federal law enforcement that comes into each jurisdiction within the states. So right now, it's sort of precedent that the federal government would investigate any type of unnecessary or issues with their federal agents or federal agency. However, we were wanting a state also investigation to be able to be proposed on the state level in case the state government didn't feel that the federal government was holding its own people or agents accountable for misconduct. Their second point was that we required federal agencies to share this evidence that is happening within these investigations. So right now, again, it is precedent that usually state and federal governments share information as far as if there's any type of jurisdictions or jurisdictions that need evidence for prosecuting a certain case of misconduct. However, this precedent isn't enough, and we want to codify that into the law. So where state and federal agencies can collaborate in making sure that evidence stays shared. And then finally, one of our more radical approaches in the law and order section was to replace the FBI with an expanded federal marshal system that would allow the states to still focus on interstate crimes that wouldn't allow a criminal, for example, to be in one state, commit a crime, go to another state, and they're a completely different person. The federal marshal would still pick that up. However, we just believe that the FBI in particular is a little bit of a bloated system and that maybe has some overintelligence and neglecting state sovereignty in that way. So we were hoping that this would kind of replace that. And then into immigration, we would actually wanting more state control over the immigration policy and determining its own state citizenship. So under our policy, immigrants would come into the United States into a state which they were granted state citizenship first, that would later be required for a federal citizenship. So the state citizenship would allow each state to essentially let people that they want into the state based on more of like a populist view that those states reflect, that the state's constituents reflect their personal views on immigration policy. So, and this would also extend to things like H-2A visas, which allow farmers and seasonal workers to come into the United States. allowing states specifically to grant these visas and hopefully take out some of the over 5 million backloaded cases that we have here in the U.S. And then our last point for immigration was that states could also choose to recognize other state citizenships. So for example, if you have a state citizenship in Texas and you don't yet have your federal citizenship, if California does not recognize your state citizenship from Texas, you could not go to California. And then finally, for counterterrorism, we were mandating that transparency and intelligence sharing between the federal and state agencies during terrorism investigations. We just thought that this is a very comprehensive approach to national security, both through any type of domestic or international threat.
Coming from the unitary proposal, we took a slightly different constitutional approach. We were grounded in both Hamilton's arguments in Federalist 23, which advocated for total national defense over domestic security, and also the Supremacy Clause of the Constitution. We identified the root cause of our major homeland security failures to be the decentralization and the systematic erosion of centralized authority. Our point here for law and order, our opening argument, was to consolidate all local law enforcement and to transition them into federal officers. We felt that this might be the best approach to ensure that there were equal civil liberties across all states, and also to provide a federal shield against local corruption. We also thought that this might provide for consistent protection in communities with a lower tax bracket, so that it's not dictating their terms of safety or approach. We also decided that this was the best way to ensure appropriate resource allocation across the country. In terms of counterterrorism, we decided that it was best to consolidate all counterterrorism and cyber defense efforts into one central system. We felt that this was the best way to dismantle the smokestack problem, where data is being passed up vertically but not necessarily being shared out. Instead of having local silos or 50 individual state frameworks, we thought it might be best, in order to share information horizontally, to consolidate into one network. In terms of immigration, we again decided to pay the appropriate deference to the Constitution and to make sure that immigration remained a solely federal issue. We wanted to minimize any state interference and involvement. This looks like federalization of state agencies. To ensure, again, that this is solely a federal issue, it would prohibit any sort of National Guard or any other obstructions from state agencies. We also would be abolishing the State Homeland Security Program, which grants state agencies authorization to act in a federal capacity, and also Section 287G of the Immigration and Nationality Act, which effectively ends all parallel state agencies and would, again, remove their obstruction with federal interference.
As you might be able to tell, we had very disparate policy proposals. However, after long sessions of discussion starting on Friday morning, we came to an agreement to resolve some of the shared issues that we did agree on in Homeland Security, which was entitled the UNITE Act, which stands for Unified National Intelligence, Transparency, and Enforcement. And I'll be going over just briefly the compromise that we came to on counterterrorism. As you might be able to imagine, because our proposals were so polarized, a lot of our compromise actually resolved on maintaining some level of the status quo. So the federal government will retain, in our proposal, supreme and final authority on matters of homeland security, particularly regarding domestic terrorism threats in the United States. This will be centralized still and continually in the DHS. And federal law enforcement will be the primary investigating body of all threats to homeland security in the domestic United States. Additionally, as regards to some of the concerns, particularly that the Confederalist position had, the more state-centered position had, about privacy violations or about federal misconduct by DHS officials or by the FBI, we proposed that federal courts, so district, circuit, and Supreme Court, would have jurisdiction and authority over determining those civil liberties issues and those federal misconduct issues. So there's still going to be oversight, even though it does come from the federal government, which all of this is standard practice today, and we decided that the best way to go forward was to continue where we were in that regard. However, we did establish a few places for reform. Our first plan for reform was to establish 24-hour state and federal information sharing mandates. So state and federal law enforcement currently, as it stands regarding counterterrorism, have shared databases, but they are not required to notify the others when conducting investigations into certain areas or certain states. So this reform would require federal officers to notify the local and state law enforcement of particular investigations going on, and especially if there is relevance to state security or to local issues, for example. Additionally, there is an ongoing practice, I'm not sure if you guys are familiar with, called fusion centers. These were established after 2001 in 9/11 because one of the reasons that we had such a horrible tragedy was because there was a lack of information sharing. Because, as Michael was saying, there was a smokestack problem. Information was moving up the ladder from lower authority to higher authority, but it wasn't moving laterally across different agencies and institutions. These fusion centers were designed so that interstate agencies could coalesce, share information regarding national and homeland security, and could work together to find solutions and locate threats. However, there have been some concerns that there isn't enough federal information sharing in these fusion centers. And so we wanted to, as a part of our compromise, propose an audit of the 80+ fusion centers across the United States to ensure proper effectiveness and to incorporate more federal cooperation in these programs to create a clear and transparent as well as safer environment for Americans regarding the issue of terrorism in our borders.
Sweet, thank you, Helen. So our group kind of took a three-prong approach when it came to law and order. So the first one's going to be a stronger federal accountability mechanism. What that looked like for our group was a variety of measures, but the main one that we kind of agreed on was requiring body cams for all federal and law enforcement and local law enforcement across the country. Right now, across the country, only 47% of police officers actually have body cameras. It is not a federal mandate, it is not a state mandate across most states. And that kind of is kind of a two-prong issue. It comes from funding, and it also comes from like the actual willingness to implement a program like that. But our biggest thing that we kind of agreed upon is from a federal approach, a lot of federal officers actually would like to have body cameras to kind of protect them on the back end. And then a lot of citizens like the transparency that comes from having body cameras on all federal, state, and local officers. The second approach we wanted to take was kind of a meet in the middle when it came to civil liberties. The federal approach kind of agreed with the confederal approach that there was a little bit of a lack of civil liberty protection post the Patriot Act, and we wanted to kind of reel that in. So we wanted to create a mandatory judicial warrant system for all information collection from both state and federal governments to kind of reel back in the civil liberties that were lost post 9/11, and also create more of a structured federal approach. So these would all go through a federal court system when it comes to warrant approval, and kind of bring back in the unitary perspective that we had on that angle. The last prong that we kind of wanted to really focus on was a nationalized standardization process for all law enforcement. So that would set minimum training requirements for all local, state, and federal law enforcement officers that the federal government would create, and then that would be the baseline. States could go above those standards, but they cannot go below them, and that would require kind of a more cohesive approach to law enforcement across the country. It would also allow states and citizens within states to feel more comfortable knowing that federal officers that go into their states are aware of all the minimum standards and they know how to work with them on a normal basis. And you don't see differences on a state-to-state basis of how you work with law enforcement. But yeah.
So next we're going to be talking about the compromise that we were able to come to on immigration. We started with reforms to the H-2A visa process, which is how farmers are able to get agricultural migrant workers into their farms to bridge the gap that we're currently seeing and the need for agricultural workers. And so we started by reforming them by delegating those processes to the states. Currently, there's a lot of red tape going through 3 to 4 federal agencies as well as the state agency just to get one migrant worker's H-2A visa, along with thousands of dollars of fees. And so we want to streamline that process by delegating it to the states opposed to USCIS. We also want to create a pathway for citizenship when migrant workers continue to renew their visas year after year. On top of that, we want to make sure that unauthorized workers are able to streamline into the H-2A visa process and therefore streamlining them into citizenship. Currently, 42% of our agricultural workforce are unauthorized workers, unauthorized migrant workers, and we want to make sure that the workers themselves are safe and that they have regulations that protect them as workers. We want to make sure that the farmers are able to get the agricultural workforce that they need. And we want to make sure that the American people are safe. And so we want to kind of center those processes on the states while streamlining them and cutting red tape. We have a couple of other reforms to that process that will make it easier, just by reforming the adverse effect wage rate, which is currently inaccessible for farmers to pay, but we want it to still be fair to the workers. So we're going to work on that with farmers and reform that process and extend it from the current 10-month cap to a 1-year cap so that it's able to provide for farmers who work in livestock or in controlled environment agriculture, and not just agricultural sectors that deal with specifically harvesting and planting. A couple of other reforms that we proposed are the states' rights on intervention. This was a compromise between the confederal approach and the unitary approach, where while the federal government will be able to institute immigration enforcement in a very federalized way, as the unitary approach wanted, governors and states will still be able to grant consultation and consent when the federal government wants to deploy troops in a non-enforcement mechanism. And so they'll retain some consent and rights in that way, while the federal government will have information and immigration enforcement that is more centralized as we continue the mandatory information sharing that we've kind of talked about across the past couple of issues. And so that information sharing will be mandated and immigration enforcement will be more federalized, essentially cutting the 287G program that we mentioned earlier.
Alrighty, and we reviewed the feasibility of our proposal not through a lens of imagining a perfect political world. We did not think that Congress was going to suddenly hold hands, sing kumbaya, and pass the perfect Homeland Security bill by lunch. Instead, we are adapting to a political world that is already expanding DHS power. Within our own groups, we get the unitary side still getting a federal supremacy on intelligence, immigration, and enforcement command. However, we are now tying that to the confederal argument around transparency, state consultation, judicial checks, and civil liberty protections. We are also avoiding a system that would create 50 different Homeland Security universes, 50 different intelligence agencies, 50 different counterterrorism systems, 50 different immigration systems. We are now working within a bipartisanship context that has historically accepted these federal growth in counterterrorism enforcement, in intelligence, and specifically, we get compromised with the H-2A visa process, where we are now tying that progressive need for reform on immigration to economic stability, job growth, and agricultural support. And who doesn't love farmers? You're also seeing the conservative side get a system that works within legality, while still prioritizing this pathway from undocumented status into legal work. You get a world where employers get an accessible legal workforce pipeline that accommodates all types of agriculture. You get workers less subject to exploitation and a clear path forward. You get intelligence gaps shrinking, and you get a broader political trust because you are now seeing this federal government growth on Homeland Security be able to be overseen, be able to be addressed by certain agencies. That is why we believe our proposal will be feasible, not because we assume everyone will love it. We won't, but it addresses the fact that political power on Homeland Security is here, that it is growing, but ultimately makes significant reform to how that political power is controlled.
Adding on to this, we wanted to quickly emphasize that our plan is financially feasible. As you can see, a lot of the costs are already based on the budgets that are already allocated to these different departments that we mentioned, such as DHS and ICE. And we also have a significant amount of offsets, which source from things ranging from simply federal and state agencies transferring responsibilities, and also things like an estimated increase in the amount of people who will pay for their visas, among other factors like the offset of labor costs now that we're making more money and now that labor is less inefficient.
That concludes our presentation. First, we want to say thank you to our advisor and mentor, Bobby, for helping us with this. And we're happy to answer any questions that you have.
Again, excellent job. Appreciate your thoughtfulness and analysis. The state, I was curious, the confederal group that talked about state citizenship, how is that even feasible? Was that an out-of-the-box kind of thought? I mean, it's pretty interesting.
It is very
just
interesting.
Never thought about it.
And let me tell you, in the room, it kind of was like, it was out of the box thinking, and then we all looked at each other and we laughed. We were like, no way. We did more research into it, and there's other countries in Europe that do sort of the same thing, where you have a local citizenship and then you receive national. Like, there's different levels. Obviously, United States is a giant place, and obviously each state has its own political views. But arguing on the confederal side, taking the extreme look for the confederal stance, we wanted states to maintain and be able to retain their own political values. We all know that California and Texas are very different politically, and we wanted as a group to honor that. So yes, it seems absolutely insane, but we just thought about it some more and we said, okay, getting a state citizenship doesn't mean you can necessarily go to the other states. And so in theory, it is an enticement to gain national citizenship. So if you get it in the state, Texas, and you're like, well, my uncle lives in Kansas, I'd like to go visit him, or I have a health scare in Georgia, it is enticement for migrant workers or immigrants to come in and say, okay, this is a temporary solution. I'm here to be naturalized as a federal citizen. Go ahead.
And just to jump on that a little bit, to add something else, it's important to note in our original proposal for state citizenship that any American citizen who has federal citizenship would have citizenship in the state in which they reside. This would be a program for specifically immigrants, citizens of other countries who were coming in, who would be able to get lower level status of citizenship in a state prior to getting federal U.S. citizenship. But if one had U.S. citizenship, they would also have state citizenship. You wouldn't have to, renaturalize every single current American citizen, just as a matter of practicality.
And I wanted to just follow up on one thing. You mentioned respect or honor the state political, different states' political, how did you put it?
I said I wanted to honor the diversity the United States offers, different politically wise across the country.
Can you see the possible danger of that?
Absolutely.
Because we have, it's the whole point of the Civil War that we're still fighting, that some states have different political views instead of this United States of America, the highest standard and values that we should be aspiring to. And at some point, and it's, I'm glad we had the unitary control here, but we must aspire higher. So I tend to, on a personal level, get very nervous about allowing states to go below that. But yes, state rights are important when they can go above it.
Without a doubt. It's a great comment.
Well, I share your perspective for what it's worth. And the two of us are lawyers, so we're looking at constitutional issues and all of this as well. It seems to me that when you frame the question you're addressing in terms of unitary versus confederal, you're sort of focused on the question of whether, as to any particular feature, the nexus of authority should be with the federal government or with the state government, acknowledging that if it's with state and local governments, you're going to get a diversity from one to another, whereas if it's a federal question, it'll be unified for the entire country. This is an obvious point. I take no particular credit for it, but there's a difference in my mind between how you structure the decision-making authority between those two levels on the one hand, and how the various agencies that are charged with responsibilities actually fulfill their authority. I say that in the context of current situations because I think some would say, at least, that the current administration has given Homeland Security a bad name. Others would say that local governments have given local security a bad name with something called sanctuary cities. So when a city says, as a matter of legal right, I have the authority to withhold cooperation with Homeland Security because I don't agree with what they're doing, my question is, how would your compromise solution here address cities? We have some of them around here who say, you're free to do, Mr. Federal Government, whatever you like. I'm just elected. I'm not sharing information. I'm not loaning you my police force. I'm not supporting you financially in any way. I'm hands off. I don't agree with it. Is that a permitted outcome under your compromised approach?
The short answer is yes, because this is such a big problem, and you'll be happy to know that we had our conversations about sanctuary cities because they're so prevalent in the news and they've come up so recently. I'm going to hand it over to someone who can talk about it more, but the short answer is our compromise does not address sanctuary cities directly. It addresses H-2A visas. But if you want to talk about sanctuary cities, I'd like to give it to Jonas.
So just quick correction. So one of the biggest strategies we wanted to do when it came to the balance of power was, as we talked about federal government still retaining a lot of that authority, we were going to preempt all state immigration laws and all sanctuary cities. So that was one of the main comparisons, is we're going to expand the visa program, create more opportunities for legal immigration and more pathways for undocumented immigrants to become documented and fix that status. But on the other hand, the federal government would still retain complete authority. And one of the biggest things that the unitary approach was like our red line in the sand, is that it's going to be unitary no matter what. Like, you cannot have sanctuary cities, and the federal government is going to take over complete authority over that process. So that was our one strong line in the sand, and in the negotiations, we'll give you visa reform and give you an easier way to get pathways for visas if you make sure that we ban sanctuary cities and do a transition of that process away to go more to a unitary approach in that model.
Okay, Confederates, from my vantage point, it appears that you guys gave away too much. So talk to me about the compromise. I saw more conceding versus compromise here. So give me a little bit of backstory behind why you gave in so much.
Yeah, absolutely. I think one of our biggest concerns across the board was that we had the information that we needed to keep the federal government accountable as the states. And so that was something that we won on every single category, in counterterrorism, in law enforcement, and in immigration, so that we know what's going on in our states and that we're able to have governors retain the right to object when there is federal deployment within their states. On top of that, the H-2A process being completely delegated to the states, giving the states the power to run those visa programs exclusively without much federal oversight, was a big win for the states, and something that we can expand to other visa processes as well, to streamline the immigration process. So while it's not the state citizenship that we've been talking about already, that is obviously a big ask, having those visa processes delegated to the states and then reformed to benefit the states and under the state's supervision was a big thing that we were wanting, on top of the ability to keep the federal government accountable and transparent. And so if I can speak more to the transparency and the accountability, if you'd like me to. Absolutely. So one thing that we're worried about is when there is a situation in a state where the federal government misacts in a certain way and then withholds evidence, we want to make sure that the states have the mechanism to get that evidence and subpoena that evidence. And so one thing that we compromised on was that exact ability. So states can subpoena the evidence from the government, sue the government, and have that information already through the mandatory sharing mechanisms. And so we want, if the federal government is going to have more enforcement authority, we still want the states to be able to hold them accountable when they act in a way that is improper or that impedes what the states are doing legally. So yeah, I think there was compromise on both sides of that. We just really wanted that transparency, and we wanted that mandatory information sharing, and we want the federal government to be accountable when they make mistakes.
So would the H-2A visa, state visa system be similar in every state, or will each state have their ability to be able to establish their own H-2A visa requirements?
Yeah, so they'll be similar under the current some of the reforms that we suggested will be kind of standard. And then apart from that, the states can kind of decide how they want to run that process.
I don't have a policy question. My question more is the third group, and I don't want to preempt the last group that's about to present, but you guys were probably further apart in your Group A, Group B than the first two. What was the process when you actually got into the compromise? And just a little, I mean, there's probably, right, there's a dozen of you, there's probably 15 different opinions of what that compromise process, but anywhere from body cameras and abolish the FBI to, you know, to state citizenship, tell us a little bit about what it was like in the room.
Yeah, it was pretty intense. I remember, so we did a lot of work in separate rooms initially when we were coming up with our proposals, and we met initially just very casually after dinner one night to talk through some of our ideas. And it got a little heated, and we really disagreed a lot. And so we realized, okay, from there we also are going to need to have compromise initial proposals, right? So we made our first policy proposals, then we made second policy proposals, and then on Friday morning we sat down and we went through each point of our compromise proposals, which we gave as a means, right, of like lowering that heat, lowering that tension. And we would spend maybe like 15, 20, 30 minutes on every single bullet point, just going through, asking questions, getting clarification, challenging the other side on what they thought. And then, you know, after every section, we would stop and we would say, okay, what are you willing to concede on and what are you not willing to concede on? And what can we produce from this, right? Like, where are our strict and harsh boundaries and where are our soft and flexible boundaries? And through there, we came up with a list of different things that we would be willing to concede on, and those were the things that we decided ultimately to put in our final proposal were those elements of our dual compromise proposals that were amenable to either side. And yeah, all of us, I would say, like, aren't perfectly satisfied, necessarily super excited and happy with this proposal, simply because we did have to concede a lot of ground and we weren't able to take a fully systematic approach because the perspectives were so different. But in that way, to me, it seems like reminiscent of a lot of policy compromises in the past as well.
Just, I know Merle's going to cut us off. It's not actually a follow-up question. Okay. It's just a comment that those words come from someone from a purple state with an independent senator, right?
I think basically Terry was asking, was your discourse civil? So. Thank you very much. Congratulations on your presentation. We're now ready for the final group of this morning's presentations, and this deals with treaties and alliances. So if they would come forward, please. Are you the moderator?
I am.
Okay.
Okay, it looks like you have to like just click through because it's on.
Do I just click the arrow? Okay. Amazing.
Should we? No, just get started. No, we don't want it.
Oh, yeah.
Okay. Oh. How do I do that? Oh, no. No. Shit. I don't know.
Just leave it. Unless there's. Might want to copy if you like. I think it's already in post.
Yeah. Oh well.
Wait. Oh. Or I think that might like. No, that's right. Yeah. That's right. It just isn't. It's just not down.
You can't press it. There.
Are we good? Okay. Hello, everyone. Good morning. Thank you for joining us on this gorgeous day. I want to welcome our panel, fellow delegates, and those watching us from home. So to begin with, my name is Adelina Popova, and I'm going to guide you through our topic, which, as you can see, is international treaty and alliance policy. But before we begin, let me introduce our two groups. So to begin, we have Team A, and these are our realists who believe that you should act solely on self-interest. And in this group, we have Yusuf, Tanuj, Samantha, Brianna, Sam, and myself. Second up, Team B, we have the institutionalists, and they believe in institutions and cooperations as a form of solving problems. And in this group, we have Dominic, Ben, Lily, Austin, Michael, Ella, and Natalia. So what we're going to do today is we're going to start off with our problem statement and our background policy. Then we will have each team give us their initial proposals. Then we will share our compromise and then answer your guys' questions. So before I do that, I'm going to hand over the mic to Lily and Samantha to discuss our problem statement and policy background.
Yeah, so like many other groups, we came to a pretty good consensus on what our problem statement was based on the current policy background on our topic. And this starts with the background of, since assuming office in January of 2025, President Trump has unilaterally withdrawn from 66 organizations and treaties, which really reflects America's wavering commitments to the international system. And the Paris Climate Accords really exemplifies this variability with changing positions with each administration over the past 10 years. And as a result, states are unable to build governance that works towards these international goals, and because of this federal government's inconsistencies. So this instability really creates the opportunity to create a new system that empowers the states to focus on building this consistency that is much harder for the federal government to replicate.
As you guys can probably imagine, there is a lot that went into our understanding of the policy background, since this is on international treaties and alliances. We sort of went through a 96-hour crash course on constitutional law, learned a lot about compacts and commissions, but the one that I'm going to highlight right now is the Regional Greenhouse Gas Initiative. And so this was an initiative started back in 2005 of a collective group of northeastern and eastern states where 7 governors signed a memorandum of understanding, so a non-legally binding contract, in order to create this initiative that is a cap trade program for CO2 emissions in the power sector. And so basically what this initiative does is produce model rule that is then sent to state regulators and state legislators, in which during the compliance periods, states have to create legislation that aligns to this model rule, or else they'll be withheld from the benefits within the initiative, such as revenue from the auctions from the cap trade programs. From the institutionalist side, we saw this as a really great sort of gold standard model for how an institution can create a cooperative market-based initiative, and one that is non-legally binding and does not require federal oversight. On the realists' side, they sort of took this as a way of understanding how cooperation and self-interest can play a role for states to want to join something like this. So during our sort of separate compromises, both groups used this policy background, and so we thought it would be good to include it so you guys know a little bit more.
So now that we have everything to understand why this is such an issue, we're gonna see from a realist perspective what their proposal should be.
Yeah, thanks, Adelina. So I'm going to take you guys through the initial proposals for the realists. So as Adelina mentioned earlier, realism is the belief that there's no authority above sovereign states. And basically countries will act on their own self-interest, and if they happen to cooperate with international law, it's just because it coincides with their self-interest. So going in with this belief, we had two main goals: to anchor treaties, international treaties, to state self-interest, so they do cooperate with these international standards, and to survive political cycles at the federal level, which has been a problem recently. So to solve these issues and achieve these goals, we came up with a mechanism of the interstate compact. So essentially a minimum of 2 or more states, if they find a treaty that they want to commit to, they will form this interstate compact. There's voluntary state membership. So if a state feels it serves their self-interest, they will join. There will be a state-led commission, where states will continue to act on that self-interest. And if they feel that this doesn't serve them anymore, or there aren't as many benefits, we will allow unilateral exit for all member states.
So for the institutionalist framework, we had a different idea, right? We wanted the states to all sign on to memorandums of alignment voluntarily to establish a subnational cooperative on foreign affairs where states could sort of find their own ways to respect international treaties and find ways that they can sort of have foreign affairs be part of this stuff, right? And so the way that this would be done is through this memorandum of alignment, which is going to be more stable than a memorandum of understanding, however, less rigid than the compacts discussed by other groups, right? And so it also would operate as a forum where they could deliberate and different states could figure out how their own statewide perspective could be seen for taking on these different foreign affairs issues. And we would also have staffs of analysts who could write model legislation for the states to adopt. Furthermore, there would be a dues system which would fund these analysts, the staffings, and the other operations of this, which would be modeled on the Council of States Governments dues system, so a mix of a flat fee as well as a proportional to the population. And then the last notable thing with this, with the dues, it also adds an institutional power of the sunk cost. The last thing is we recommended a provision whereby if the U.S. Government on a federal level has signed on and ratified a treaty, then the state governments could, and they haven't passed any sort of legislation to enact that treaty, then the state governments could look into that and find ways that they can address those commitments that we have.
So now, after hearing these two proposals, you can clearly see that each of these two groups want to go about forming this solution in different ways, which is where the entire premise of this project comes in, the agreement. And so now I'm going to give it to Yusuf, Austin, and and Natasha to explain what our compromise is going to be.
Thank you, Adelina. Before getting into the actual meat and bones of the compromise, I want to walk you through our process towards compromising. We faced a lot of unique challenges that other groups didn't face. Most obviously, international treaties are something that the federal government has exclusive authority over, despite the trickle-down effects on states, which complicates sort of the framework and the pathway for states to create a solution that increases stability. On a related note, also states do not have the the existing institutions in place to foster such a relationship. We had to do a deep dive, as Lily was explaining, into some of the existing laws and Supreme Court precedents to make sure that any agreement that we had reached would satisfy existing precedent, starting with the 1892 case Virginia versus Tennessee and working up to very modern compacts that exist today. So with that as our backdrop, we sort of worked towards our actual compromise, and we had 6 main variables. Beginning with the realist and institutional perspectives, realists were more after a theoretical framework that empowered state autonomy and allowed states to work in their own self-interest. Whereas in contrast, the other team wanted more of a rigid structure that would promote cooperation and have rigid boundaries in place to make sure that states were aligning with one another in joint cooperation. We ultimately were able to resolve this by recognizing that if we could create a sort of forum where states retain their ability to have authority and sovereignty over their policies, that could work. And this mutual concession led to the basis of our compromise, which we will now hear about.
Thank you, Yusuf. So the third point of contention was the legal mechanism. And as previously outlined before, from the realist perspective, they advocated for a formal interstate compact, which these are legally binding. And this was a way to ensure that compliance was outlined by law. From an institutionalist perspective, we proposed a memorandum of alignment, which is a non-legally binding agreement. And we believe that states would be motivated to join based on this rules-based system, which is incentives-based. Additionally, this was our way of evading congressional approval because it was voluntary. And then the fourth point of contention was funding. From the realist perspective, they were concerned with the free riders problem, right? If smaller states and larger states pay equal dues, wouldn't the smaller states just free ride the larger states' compliance to some of these international standards? And then conversely, when we're looking at whether larger states would benefit from this lack of shared responsibility if their dues are the same as the smaller states. And so the realists proposed a proportionally scaled, population-scaled fund to mitigate this. And from the institutionalist perspective, we believed in a model similar to CSG's annual membership fee that is a flat rate. Thank you.
All right, and then for enforcement, the idea of enforcement, right? People who are the states that are joining this cooperative or this institution, how do we ensure that they follow the agreements that they say that they're going to follow? For the realist, right, they didn't want any type of enforcement mechanism because, you know, if you have strong enforcement mechanisms, then what's the point of joining, right? You don't want to be binded to things that you don't want to do, which was completely opposite to what our institutionalists want at the time. You know, they wanted a lot of enforcement, you know, a certain amount of years that you had to be in, fees that you had to pay if you don't, you know, follow your agreements, and that kind of aligns parallel to our exit provisions. The idea of an exit provision, you know, when you're in this cooperative and you want to exit, how do you go about doing that? Once again, we saw the realist, they wanted the ability to exit pretty freely, pretty quickly, right, without any type of fees. Our institutionalists wanted some strong fees, a long amount you needed to, you know, say in advance for a specific amount of time. And so we saw this parallel between enforcement and exit provisions. I'll allow our colleagues here take it for the actual proposal.
Amazing. So now that we have laid out all of our arguments from our compromise, we're gonna actually talk about how it works.
Hi, all. So our proposal is essentially that states will pursue entrance into a subnational cooperative on international alignment. They will do this by signing a memoranda of alignment, as one of our other proposals has already discussed. The cooperative will essentially function as a forum for states to come together to discuss best practices for implementing these often fraught, contentious international issues. Now I'll walk you through our organizational structure. The forum will be comprised of one representative from each state. This representative will be selected by a process determined by the individual state themselves to essentially persuade our realist friends over there. So then these representatives will then come together to elect the executive director of the cooperative. The executive director will be in charge of looking at hiring, so things like policy analysts. One of our big goals with this idea is that we will have policy analysts who are able to draft harmonized model codes for the states. This will come into effect if 2 or more states agree on a topic they want to pursue, so an international standard. The executive director will have the responsibility to inform the representatives of what's going on in the international arena so they can make the best decisions. The individual states will be the ones to decide which policies they want to pursue with the help of the analysts drafting that legislation. The states will then take this legislation back to their state legislatures to be passed with the help of our lobbyists that we will have on staff.
So now this all kind of begs the question of why would states want to join this organization in the first place? And the way we kind of conceived of it is that there are 3 main benefits for these states to join this cooperative. First, that we see it as a way to reduce costs. The states will have to invest much less money and individual resources into researching these policies and drafting legislation. Second, we also see it as a way to promote more efficiency between in negotiations between the states, as the forum will create a centralized hub for state legislators and state officials to come together and negotiate policy. And finally, we see it as a way to stabilize state-level policy in the absence of a federal government, in the absence of federal directives that actively oppose international standards, and in the context of a federal government that is inconsistent with its federal policy, with its international policy, depending on the current administration. Also, turning now to the funding structure of this organization, as we've already mentioned, we hope to model after CSG's funding structure, with states paying dues, and as well as a added fee based on population of the states, as well as looping in relevant stakeholders to, in the private and public, in the non-government and civil society sector to help fund research in policy areas that they care about.
So last, what we're going to talk about is the withdrawal mechanism. So in order to formally withdraw from SIA, states must first satisfy two preconditions. The first one being give a 5-year notice, and then the second is pay a year's worth of dues. So a 5-year notice is imperative for outliving partisan presidential elections and creating a framework that remains stable rather than reactionary. And second, requiring 1 year's worth of dues discourages arbitrary withdrawal, and it also helps ensure that the CA is still operating during these transition periods. However, an exception to this would be if a state wants to shorten their 5-year notice period, they can do so by paying 4 years worth of dues while still remaining a member of CIA for at least an additional year. And then we'll have Sam conclude us off today.
I'm going to stay here because I feel alienated at the end. But just to conclude, do you want to do the conclusion slide? Thank you. To conclude, you know, our organization is the result of initial dispute, of cooperation, and then ultimately compromise. Compromise between the realist perspective and the institutionalist perspective. I think both mutual benefit is achieved by both. You know, for the realists, we have this framework of the voluntary nature of this. You could free to enter and exit. You are free to sign on to agreements considered by the states, whether and evaluate whether that's in your self-interest. For the institutionalists, you know, it serves their interest because we're creating an organization in our world of anarchy, which is kind of the issue. Further, you know, our problem statement is about stability in our international system. We have federal power that is consistently re-entering and withdrawing from international agreements and the customs of the international system. What we have here, I believe, is a system in which the states are given authority, which they are legally entrusted to. You know, Article 10 of the Constitution gives states the authority over non-federal powers, and in the international community can offer some of those you know, language and ideals that states can implement. It's not everything, but in the situations where the states can emulate that international law, they can pursue their interests as they deem fit. And with that, I'd like to thank you all and open it up to any questions that you may have.
I get to go first this time. So I'm going to use an example, and I'm struggling a little bit with the realist approach to, like, the USMCA. You're talking 3 countries that is about to have to get authorized or renegotiated, or you can withdraw, all those type of things. And all of a sudden you're in this position where what Michigan wants may be different than what Texas wants from a USMCA, let alone a Paris Accords. In reality, not using the realist, I'm trying to use it in practice, right? In practice, how does the federal government go renegotiate USMCA when they have to herd the cats of Michigan versus Idaho versus Texas? And I'm just using border states, let alone Iowa, Nebraska, Kentucky, whatever. So it just seems like such a tall tale or a tall order to get all of the states aligned to an international treaty versus the RGGI. I think one of the two it was that talked about, which was 7 states or whatever it was.
Well, thank you. And I think that's what's happening now with the federal government, where the states and the Senate are coming together to ratify these treaties. I think what we're proposing is different in the case that the United States, the Senate, can't ratify something because of the very issues that you bring up. And so we're allowing a forum between the state legislators as opposed to the federal governments to create broad coalitions larger than this, but it also puts together these state legislators in dialogue that they never had before. Michigan and I forget the other state that you mentioned, but one that's very different political-wise. And so I think that is the main reason for the forum. We were also looking at many other examples, such as some states passing laws banning the new sale of gas cars in alignment to some of the international directives. And so in that way, too, we would be bringing states together with those different priorities, but also allowing them the opportunity to have dialogue and then reflect that in the different model legislation, where maybe there are compromises between states, those who are producing the new cars, those who are gas producer states, as opposed to East Coast states that have more of an incentive, urban states or urban centers that have more of the incentive to do that. So I think that issue that you bring up is kind of something that we're seeing right now, and that's the reason why a lot of these treaties are not being ratified or renewed. And so that's why we're trying to bring the state legislators themselves and trying to get rid of the polarization. I think that's one of the better things about state governments right now, is that we're seeing less political polarization. And I think that's also why we wanted the 5-year plan. It's not a 5-year notice, it's a 5-year minimum, and that is also to ensure that the alignment with the cooperative exceeds that of any president or governor of a state. And so that makes sure that when a president or a state from a different political party comes in, they aren't just automatically bringing or the states aren't either coming in or coming out based on politics. And so that also tries to do the longevity in which the dialogue can occur.
What did your dues structure look like?
The due structure, yeah. So that was one of the many issues that we had compromised for the final proposal. We are going to base it off of the Council on State Governments. And so the Council of State Governments has about $60 million that they use every year, and that comes from each state. And each state provides both a baseline fee as well as one that is an additional fee that's proportional to their population. So I think a state like Colorado provides $600,000 to the Council on State Governments. And so that's something that's the framework in which we'll do the fees. That's something that we haven't done yet. I know we were talking about the need for policy advisors for the cooperative, and sometimes we need that too. We're not budget professionals, and so that's kind of the framework in which the dues would be processed, as well as additional ones from NGOs and private organizations that are topic-based, especially as we see many different alliances and treaties cover a wide range of topics, from climate change. AI was another one that we were talking about, human rights, and so other organizations too who are trying to uphold those and uplift those in the United States would also have an incentive to help this organization.
And your thought process behind going with a 501c4 for this?
Yeah, the 501c4 was specifically for the lobbying aspect of it, both in that we would see issues in which a representative from a state would want to agree to the proposal, and yet it would still have political turmoil back in the state legislature, and the cooperative would then be able to help facilitate that by bringing lobbyists to the state legislators to talk with their state reps, state senators there, but also in the case that states want to pursue more legally binding contracts with each other, they would also be able to go to Washington, D.C. and lobby there too. And so we wanted to ensure both the nonpartisan, nonprofit, but also retain the ability to help states pass this legislation through their state legislator, looking at the political feasibility aspect of it.
Hi, you all were given a tough one here. I'm trying to get my head around what the mission, what were you presented in terms of what you're supposed to do? It appears as U.S. state alliances join agreement, which I don't know what that is necessarily, and then we get into this unprecedented administration who has acted lawlessly, but with a strong arm. And we've apparently are dealing with a situation where I'm assuming this group has deemed the alliances and treaties that have been trashed to be valuable and important, and you see value in states and the people who live in these states to want to do something about it. Am I right so far?
Yes, certainly.
Now, so my first thought was this is very tragic. It is very, it's almost fatalistic. It's like feudalistic and fatalistic. It's almost like your assumption is that's the way this nation's going to be, and we've got to have the states. Again, we're devolving what should be strong, honorable, federal, national power according to every good value that we've known as a nation, and that universal morality would say these are the right values, and that's what we aspire to be and have been for most of our history. Yet we are now pushing that down to the states, 50 different states. And it's, you see the danger in that?
I want to
I'm
sort
not
of.
saying that this, you were given, I'm not saying you were fighting against that. You were given a tough.
There still is a collective agreement, like when the United States signs on to an alliance or treaty. There is still that federal element. It's just a lot of the implementation to actually create movement on those different topic areas of the treaties just happens on the state level. Because when we see that the pendulum just keeps swinging back and forth every 4 years in terms of the United States' political ideology, there's not a level of consistency that creates any progress on these issues. Right, so we've talked about the Paris Climate Accords multiple times, but when we are constantly changing our goals on the way, or our processes or commitments on decreasing CO2 emissions, we're not making that same progress. When we take the similar guidelines that something like the Paris Climate Accord has on the state level, we are actually making progress on those issues, which it might be abysmal to think about, but if we want to truly make progress on any issue that not only benefits a nation, a state, the world as a whole, we have to ensure that there's a level of consistency there, which states do. So.
And I think, too, I definitely see your concern about pushing it down to the states. But as Sam pointed out, I think that what we're really trying to do is empower states to use the powers that they have enumerated in the Constitution. Since the United States ratified the UN Charter, it does say that the United States will go along with trying to go towards progress and uplift international directives. And while they skirt that, the 10th Amendment does give the states the right to try to uphold that and pursue those goals of international directives. And as you said, hopefully this would kind of light the fire to make the federal government and Congress then push towards national treaties, ratify these treaties, laws, and of course, we completely recognize that any national law that is made would supersede that of the states, and then in that case, the state laws, the model legislation would become almost like trigger laws in the case that we're seeing now where we're going flipping-flopping between treaties, alliances, and international agreements.
Just one more question.
Yeah, absolutely.
So what happens when you have these alliances between states and you have a rogue state? In other words, they hire a rogue governor who does the same thing as this, or a legislature that is able to just trash whatever was done. Now, I think you had an enforcement mechanism. I didn't understand it.
So I think the biggest thing is what we're seeing is that with the model legislation, the cooperative also will spend some money in those states to look at the progress of the legislation, the data collection, and see how well it's pursuing, especially as we're seeing some of the climate change ones. And so that is something that the states who aren't in agreement wouldn't be able to access. And so I think that's the biggest aspect we were also looking at in cases. Something that also motivated our proposal and compromise was California's previous memorandums of understanding with China. And so in that case, we would hope an organization like that would foster communication between the states to engage with nations like that together as opposed to separately. And so in that way, too, I think that we would see states who are left out of those memorandums of understanding be more motivated and incentivized to join this organization in a way that they'll be fostering economic and trade agreements and understandings with foreign nations like California did. And in many instances where we have a rogue state or smaller states who are not able to engage with foreign nations in the same way that California is one of the largest economies in the world, never mind a state, I think that would be one way.
One way our agreement tries to prevent something like that too is every single state has their own method of choosing their delegate, right? So strategically, you're going to want to select a delegate that understands the intricacies of each state. So.
Mine is a comment, right? This is my first year judging, and this is to everybody. I've known Dr. Hackbart for years, and he's talked about this society. You've given me your passion and your focus, your openness to new ideas is giving me a kind of a reinvigoration about the future of America. So thank you for that.
You kind of stole my thunder, Terry. I deliberately, I wanted to go last. I passed the baton to you so that I could say something of a benediction, but my message is basically the same, and that is that I'm speaking to all of you now. I thought your presentations were absolutely extraordinary. I'm not like you, Terry. I've done this for 5 years as far as I know, and I believe this is the best collection of presentations that I've ever seen. But it's not just your collective effort, it's you individually. I look at each one of you and I see people who are so impressive by your energy and your intelligence. But mainly what I see are people who find great joy in grappling with the kind of questions that if they were to find the answer would make life better for everybody. You know, there's something really good about that. It may not seem like it, but it's, in my mind at least, it hadn't been so many years ago when I was doing what they were doing when I was in college. I'm not denying. You can look at me and tell how that wasn't just a minute ago, but I found great satisfaction in doing the same thing that you're doing. And I guess when I look at you, what I want to tell you is that I know, by virtue of my own experience, the place that your current interest leads to. And from that, I want to tell you, you're on the right track. This could be a very joyful experience that you could devote your very best energies and your intelligence to for the rest of your life. And I applaud you for that. And in fact, all of us of this generation are relying on your group to come back and clean up some of the mistakes that we've made, because I don't need to tell you that we've made a few. I also know that you're leaving Lexington tomorrow, and before you get away, I would want you to know that we hope you felt welcome here, because you are welcome here. This is a welcoming community that we have here. It's a very unique place. It has the thoroughbred industry as its signature, but the real economic engine in this community, you're standing in it right now. It's the University of Kentucky. It's more than a school, it's an empire. And I have found Lexington to be a very interesting admixture of the sort of hospitality that was typical of aristocratic cities in the South, with a highly progressive influence, mainly from this university. We bring into Lexington people like you with big ideas in their heads. They influence the culture here in Lexington in a profoundly and pervasive sort of way. And it makes Lexington a wonderful place to visit and also to live. I've done that all my life. I'm quite an advocate. This is a great, great place. Finally, I want to give a little pep talk for something called the Martin School, because if you continue to have an interest in the sort of thing that you're talking about today, you'll almost undoubtedly end up pursuing some graduate education in that area. You could do a heck of a lot worse than the Martin School. And it's one of the top graduate schools in public policy in the country. I don't know that the volunteers like us are what make that happen, but I will tell you that we're inspired to contribute some volunteer time because all of our collective life experiences have taught us that people with skills like yours and people who have the skills that we develop at the Martin School end up making the world a better place, and they make people in leadership positions like me look better. That makes them pretty important. So I recommend that if you are interested in pursuing this, we'd certainly be happy to talk to you about how it works here at the Martin School. In any event, you honor us by what you've done here today, and we're very proud of you. Thank you.
With that, we'd like to thank our last group for their presentation. Just a few technical announcements. First of all, we'd like to thank our judges. It's been a very important part of these presentations. The questions and discussions back and forth have, I think, added to the overall event. Thank you, Bill, for being here this morning and providing leadership for the Clay Center. I've enjoyed working with you over the years, and so we look forward to it in the future. And finally, thank all of you, and let's get everyone a rousing round of applause for all your presentations. Okay. Right. On the technical side, I think as we know now, our judges are going to be doing their evaluations. We've thought about putting them in an isolation booth, but they're not as readily available as they were 30 or 40 years ago. They proved not to be that isolated anyway, so we thought, well, we'll just keep it out in the public and more transparent. On the technical side, for those of you, the students, lunch will be served back in the dormitory momentarily. I think it should be there by 12 o'clock. Now, the operational aspects going forward, tomorrow morning, well, first of all, the rest of the afternoon is your time to relax and enjoy some time off. I know you've been working very hard. You're probably close to exhausted. And I have to admit, part of the reason we have such an intense program, it also is another kind of experience that you might have in your future careers. In legislative bodies, for example, it gets very, very tight to fit within the time frame that state legislatures in particular have available to them to meet their obligations. And I think the result is when you work very intensely, you actually produce many times better results. Technically, as mentioned, lunch is now going to be available. Tomorrow morning, we're going to be heading to Washington. Excuse my voice. Tomorrow morning, we will have snacks available for you at 8 o'clock at the dormitory. Please do your packing, set your alarms, or talk to your buddies to make sure that they wake you up or you wake them up. The bus will arrive at 9 a.m., and we'll be heading for this enjoyable trip to Washington, D.C. There'll have to be breaks along the way. Yes, question? Pardon? Good question. No answer. Just leave them there, I think. Yes, right. Okay. And I'll check on that, and if I have an answer to that in the morning, I'll spread that around, okay? But just be ready to load the bus at 9 a.m. I know that gets to be a little bit of a struggle. The bus will be full, as you might expect, but there will be breaks along the way. So there'll be snack breaks and just breaks along the way. You'll be arriving in Washington, D.C., excuse me, about 6 p.m. There will be dinner available there in the area at the American University dormitories. You'll find the accommodations there very good, and I think you'll enjoy that as well. So tomorrow evening, just relax. Monday, we're starting the Washington, D.C. portion. There will be kind of a get-together around 10 o'clock, so you can sleep in if you like after you've been getting up so early every morning during your time here in Lexington. It is Memorial Day, so D.C. is rather quiet. Congress is out of session, but we're going to basically provide you transportation to the mall, so you can spend your time, for those of you who have not been in D.C., just walking around the mall, enjoying the mall would be I think, a useful experience. Monday evening, we'll have a get-together in Naval Yard. We'll talk about that for a place to kind of talk about the rest of the week, the activities that we started on Tuesday morning at the Supreme Court, and I think we shared some of the ideas of the activities for the week, which will also be very busy, very compressed, and so I think you're going to have a good time in D.C., culminating with the event on Thursday evening at the Congressional Golf Course. It's a great place, beautiful place, and most importantly, that evening we'll be announcing in the judges' opinions which of the teams has presented their position paper presentation the best. And we'll have an award ceremony for that. And we'll also be identifying, releasing the name of the outstanding negotiator for each of the 4 areas. So we'll have a full week. I think you're going to enjoy it. We're hopeful that the weather will be as nice there as it has been here, with some slight improvement. And that's about all I have. But Bill, you have a comment.
First of all, each and every one of you should feel very proud. It was amazing. I couldn't notice, but every one of you, I use the old phrase, stand and delivered. You stepped right up, unflinching, and took it on. And that is the biggest goal we have. You heard from Brad. You've got a group here that I think I can say is beyond our expectations. It was, I don't know, I don't want to be a judge. I warned you they were discerning. I said they got critical eye. I think you got a good taste of that. But you should leave here no matter who wins, and you'll find out. You won, all right? You've each achieved something here, I hope. And I can tell, I think a little bit from the way you looked last Monday than today, where you've traveled a little journey. And that makes our hearts pound. Robert was here and he left a minute ago. But you should feel good, period. You needn't wait for a verdict. I think a lot of you have won already. And lastly, I have to thank Bob Urban and Kevin Reilly here, who I hope some of your folks back home could catch some of this. They'd be very proud. So we send you off now to D.C. representing us, and make eyes open and turn heads there, and we'll see you there. Bye-bye.
And just one final comment. I fully agree with Bill. You're all winners. You've done a tremendous job. And we put in this competition just to give a little bit of an edge. And I could see that you did make your presentations with a little bit of edge, with the determination that you're going to be the winning group. And I think it improved the presentations from all 4 groups. And you all did a great job. I enjoyed it. I learned a lot, be honest about it. Things I didn't know about. You got into a lot of details which I simply did not know. And I was really impressed with that. And I thought the experience was very valuable and enjoyable. So good luck this afternoon. Have a nice break. And we'll see you tomorrow morning between 8 and 9 a.m. over in the dormitory. And we'll head to Washington.